Madam Clerk, are we ready?
Yes, Chair, we are.
Okay. I'd like to call to order the January 13th, 2026 meeting of the Santa Cruz County Board of Supervisors. Will the clerk please call roll call?
Certainly. Supervisor Koenig?
Here.
Martinez? Here. Cummings?
Here.
DeSerpa? Present. And Hernandez?
Present. Would any board member like to dedicate today's moment of silence? President Cummings?
Thank you, Chair. I'm a little winded, trying to get here, but wanted to dedicate today's moment of silence to Renee Nicole Good, who was a mother of two in Minneapolis, who was shot and killed by ICE officers last week. And it was completely unnecessary what happened in Minnesota. And I think it's important that we're continuing to hold ICE agents accountable for their actions, and we do everything in our power to protect our community. Also wanted to dedicate the moment of silence to Bob Weir, who was one of the founding members of the Grateful Dead, a band that truly changed the world and had profound impacts on the Santa Cruz community, including the Grateful Dead having their archives at UC Santa Cruz. And with that, I'll my dedication to today's moment of silence.
There's no one else. Will please join me in the moment of silence. Please join me in the Pledge of Allegiance. Pledge allegiance to the flag, United States of America, and to the republic which it stands, one nation, under God, indivisible, liberty and justice for all. I'd like to ask the County Executive Officer, Nicole Colburn, if there's any late additions or deletions to the regular or the consent agenda.
Yes, Chair, we have.
Oh. Turn my.
We have a deletion from the consent agenda.
You might want to say that in the microphone.
What is that?
We have one deletion from the consent agenda item number 23.
Next, I'd like to see if any board members would like to pull any items from consent.
And pull item
Supervisor Cummings.
This is item 16, which is related to the housing proposals for 701 Ocean Street.
The other one was 29.
23.
Oh, we're. So 29 will now be 9.
16.
Uh, 16, sorry, be 9.1. With that, we'll move on to public comment. Any person may address the board during the public comment for up to 2 minutes or as limited by the chair. Speakers may comment once and must address either item, either an item on today's consent agenda, closed session agenda, or topic within the board's jurisdiction. This is not on the agenda itself. If the item is on the agenda at a later time, please wait for your comment on it until the agenda item is brought to the chair of the Board of Supervisors. It's back there, actually, so it's not in the front.
Good morning. Buenos dias. My name is Becky Steinbrunner, and I have learned that Spanish translation is only available upon request. And yo quiero preguntar que por favor hace translación automático. I want you to make these meetings automatically translated in Spanish. The people listening who could not be here, maybe from Watsonville, cannot understand anything that you are saying now, cannot understand anything I am saying now, unless there is automatic translation. And if I'm wrong, please correct me. But I asked at the clerk's office and learned that it is available only on call if you have not asked 72 hours in advance. So please make that change and make our county more inclusive for participation. I want to thank you Chair, for making the proclamation that January is National Human Trafficking Prevention Month. This is very important. I want to submit a copy of the 2024-2025 Civil Grand Jury Report, Human Trafficking in Santa Cruz County, Voices Unheard, Signs Unseen. I have just read the responses your agency posted. They are now available on the Grand Jury Report website. Thank you, and I look forward to seeing those improvements made. This is critical because two large events known to be magnets for human trafficking, the Super Bowl and the World Cup, are coming next door this year. We have to step up our efforts to raise awareness of human trafficking and help our youth who are vulnerable be protected. I want to formally recognize the excellent efforts of Aruka Project and Rising Worldwide as survivor-led help for these survivors. Thank you.
Thank you.
Good morning, Chair Hernandez and distinguished members of the board. Angela Chestnut with Janus of Santa Cruz. On behalf of Janus of Santa Cruz, we want to express our sincere and heartfelt thanks for your proclamation recognizing January as Substance Use Disorder Treatment and Recovery Month. This acknowledgement carries deep meaning for the individuals and families we serve, and for the dedicated staff and partners across our community who work every day to support people on their path to recovery. Substance use disorder is a chronic treatable medical condition. We know from decades of evidence that when people have access to compassionate, timely, and effective care, lives are saved and recovery becomes possible. Your recognition helps reduce stigma and reinforces the message that treatment works and that every person deserves the opportunity to heal. We are grateful for your leadership and for the county's ongoing commitment to expanding access to care and strengthening the partnerships that make every recovery possible. Thank you.
Good morning, members of the board. My name is Stephanie Vicati, and I'm a program manager within the Family and Children Services Division of the Human Services Department. Family and Children Services plays a critical role in ensuring child safety, well-being, and permanency while supporting and strengthening families. I'm here today to thank the board in declaring January Human Trafficking Awareness Prevention Month. Human trafficking is defined by the U.S. Department of Justice as a crime that involves compelling or coercing a person to provide labor or services or to engage in commercial sexual acts. While human trafficking can happen to anyone, certain populations are at increased risk, including individuals affected by prior abuse or sexual violence, poverty, unstable living situations, or homelessness, as well as those who are systematically marginalized or underserved. Human trafficking is preventable when we work together to build a coordinated and community-wide response that strengthens individual, community, and societal understanding and resilience and recognizes and reduces social inequities. On behalf of FCS, I want to express my sincere gratitude to the Board of Supervisors for lifting up this very important issue. By doing so, you've taken an important step in raising public awareness and helping our community better understand the realities of human trafficking and the importance of prevention, education, and survivor support. Public recognition plays a vital role in encouraging dialogue, reducing stigma, and empowering residents to recognize and report trafficking in all its forms. Thank you for your leadership and for using your platform to help inform and protect our community.
Good morning, Chair and Supervisors. My name is L'Oreal Weitzel, and I am the Executive Director of Aruka Project, a local nonprofit here in Scotts Valley that fights human trafficking through prevention and education, active rescue and recovery, and restoration for the victims we have rescued. Human trafficking is not a hidden or hypothetical issue in Santa Cruz County. In fact, the 2024-2025 Santa Cruz Civil Grand Jury Report made it clear. Trafficking is happening here. Survivors are being missed, and critical gaps remain in the awareness, coordination, and survivor services. The report highlighted what many of us working in the field already see, that victims are often overlooked, signs go unnoticed, and resources after identification are limited, especially when it comes to safe, trauma-informed shelter for survivors to go once they have been identified or rescued. I want to thank you for this proclamation recognizing January as Human Trafficking Prevention Month. It is an important step. It acknowledges the reality documented by the grand jury and affirms that our county is listening. But awareness must also lead to action. Continued collaboration, education, and survivor-centered solutions must continue. Survivors are here, the need is real, and the time to respond is now. Thank you for taking this issue seriously and for standing with survivors in your community. Thank you.
Good morning, Chair and board members. My name is Natasha, and I am the Deputy Director of Aruka Project. We are proud to be survivor-led, and I am that survivor. I was raised here. I went to school here. I was kidnapped into sex trafficking at 19 years old. I was trafficked all over the country, including Santa Cruz County. After I was rescued, there were no resources here for my family and I. My journey was a very difficult one to get to where I'm at today, but it didn't have to be that way. I felt alone, and no matter how much support I had, I knew no one could understand the pain I was in. I was called a liar and told I do not look like a victim. 17 years later, my trafficker would be sentenced to 174 years in prison. Currently known as the most prolific sex trafficker Central California has ever seen, with an estimated hundreds of victims from this county and surrounding areas. If I had had a place like Aruka Project to walk with me on my journey, I know for a fact I would have made different choices. I would have begun my life of healing a lot sooner. One of the most healing moments for a victim is realizing you are not alone, that there are people just like you who know what you are going through. Aruka Project is tirelessly working to restore the lives of these victims. With that comes the desperate need for housing. The most frequent question asked by victims is, do we have a place for them to go? Unfortunately, our answer is no for now. As we work together as a community to fund our Hope House, we still manage to rescue victims weekly on a limited budget, offering resources, support, and justice. My story is real. If it happened to me, it can happen to you or someone you love. How blessed Santa Cruz County is to have a place like Aruka Project to protect this community, offering a safe place for every victim and their families. Thank you, Chairperson and board members, for recognizing the victims rescued and those yet to be rescued in Santa Cruz County, waiting for Aruka Project to respond.
Madam Clerk, is there anybody online?
Yes, Chair. Call-in user 1, your microphone is now available.
Marilyn Garrett, where is our tax money going? You can give direction to the executive branch. In the last year, the executive branch of government dictatorially has bombed, destroyed, and murdered people in 7 countries. The war at home continues with ICE raids in communities of color, including here in California. As in Nazi Germany, Gestapo, ICE, kidnapping, and child sex trafficking, murder, and disappearance of innocents in concentration camps is taking place. I call on this board to join with other elected officials to halt this fascist takeover and theft of our money. Part of the wars are the weapons of war, which include 5G and other wireless and surveillance technology. I also call on you to oppose the bill before the Federal Communications Commission, falsely titled Build America, Eliminating Barriers to Wireless Deployments. Today is the last day to respond. It's WT docket number 25276, and I refer you to Nina Beatty's comments on this notice.
Thank you.
Skylar, your microphone is now available.
Hi, thank you. My name is Skylar Sakoulis, and I am an environmental justice organizer with Green Action for Health and Environmental Justice, as well as a Santa Cruz County resident. Today, I asked the Board of Supervisors to further amend the proposed battery energy storage system ordinance in order to protect community health and safety, as well as our environment, from potentially dangerous battery storage systems. The ordinance currently outlines additional protections for some sensitive populations, but excludes socially vulnerable populations like low-income communities and environmentally burdened communities. This is especially important while New Leaf Energy is moving forward with their lithium BESS project on 90 Minto Road in Watsonville, right next to an affordable housing complex. Necessary efforts to decarbonize and move toward clean energies should not rely on solutions that continue to put marginalized communities at risk. I join others in asking that the Santa Cruz Board of Supervisors produce and adopt an ordinance that protects and prioritizes the community and environment first. In addition to more robust safety requirements that protect neighboring communities and the environment, please also include incentives for non-lithium battery in the ordinance. And my final comment is to please continue this discussion at the February 10th board meeting that is scheduled to be held in Watsonville in order to provide better in-person access and involvement for residents living near the proposed lithium BESS facility, as they will be most impacted by an inadequate ordinance that does not thoroughly protect their health or environment. Thank you.
Madam Clerk, I just want to state that if you speak on an item that's on the agenda, you will not be able to speak on that item once it comes up on the agenda again. Thank you.
User, your microphone is now available.
Is it for me?
Yes.
Yes, hello. And I will start with the reminder. It's difficult for me to file a complaint in writing because it's second language for me. And I still very upset that I never hear back from Board of Supervisors. And lately I reported constantly about 2 slow murders. And one of the elderly who is 94 years old and locked up in the Santa Cruz post-acute facility for 2 years already, and just on the death road. And the other one at the behavioral health, committed by the behavioral health division, and that going on already for 15 years. And I never heard also from the health service agency, Connie Marina Peraza. She's a new director, and I'm very upset that I cannot hear back from her. And I also don't hear back anymore from Marnie Sandoval, a director of Behavioral Health Division. This is irresponsibility of the high-level agency who's supposed to answer serious concern, and they do not. I also wish that the district attorney will be present at the meetings and will sit across the county council. County council is here and the administrator is here, board of supervisors is here. Why district attorney is not here? Especially that when you come to their window, they refused to schedule an appointment with district attorney. And it's about serious crimes and why district attorney door is closed. So please think about it and make it happen.
Thank you.
You have no further speakers, Chair.
Thank you. With that, I'll bring it back to the board, see if there's any questions, comments, or if they would like to move the consent agenda.
Yes, thank you, Chair. Just a brief comment on item 39. I want to thank Public Works Division for quickly completing the improvements on Miller or the repairs on Miller Cutoff Road and timely repairs like this, which is actually from the December 2021 storm, are particularly important right now given the pushback we're seeing from FEMA on reimbursing these projects. So thank you.
President Martinez.
I have no comments. Thank you.
Okay, we'll bring it back to see if anyone will entertain a motion.
Move consent.
Second.
We have a motion from Supervisor Koenig and a second from Supervisor Martinez. Madam Clerk, can we please take roll call?
Supervisor DeSerpa?
Aye.
Cummings?
Aye.
Martinez? Aye. Koenig?
Aye.
And Hernandez?
Aye, motion passes unanimously. We removed one agenda consent item and one we're going to read later on. 16 and 29. 23, sorry. Next on the agenda is to consider selection of chairperson and vice chairperson for the calendar year of 2026 of the Board of Supervisors. As is customary, the chair and vice chair positions rotate annually. The recommendation is for Supervisor Monica Martinez to move into the chair position and Supervisor Manu Koenig to serve as vice chair, representing District 5 and District 1 respectively. That is the recommendation before the board. I will open it up to the public for public comment. Anyone in the public wishing to address us on this item? Seeing none, anyone online?
I see no speakers online, Chair.
I will now turn it to my fellow board members, see if anyone would like to comment or make a motion.
Chair, I'd just like to use the opportunity to thank you for your service to this board and to the county over the last year. You did a commendable job and led us through some challenging meetings with grace. So thank you very much.
Supervisor Martinez?
Thank you. Well, thank you to my colleagues on the board. It's a very exciting time to be joining as chair. You know, we have a number of significant challenges before us that I'm really honored to serve and help navigate on behalf of the Board of Supervisors. I'm also very excited to be taking on role of chair at this time to support our new CEO, Nicole Coburn, as she takes the reins in leadership in county government. And this year, we're going to be working on a number of important things, including our upcoming strategic plan and operational plan that'll really set the foundation of our work in the coming years. So I'm excited to preside over those deliberations. And really, my goal as chair is to help facilitate a healthy and respectful dialogue between the board, staff, and the community that really promotes a sense of opportunity for public input and transparency in terms of our decision making. Also, Chair Hernandez, I want to thank you for your leadership. You have led us with humor and clear direction, and it's really been an honor in my first year as a supervisor to work with you.
Thank you. Supervisor Serpa.
Thank you. First of all, to Supervisor Hernandez, thank you for leading us this year. It's our first year on the board, Supervisor Martinez and I, and it has been an interesting year, a difficult time to take a seat in county government, and we'll get through this next 3 years together. I'm wearing a pin today that was given to me by somebody very special. And I want to read what it says. It says, "Women belong in all places where decisions are being made." Ruth Bader Ginsburg said that. So I'm going to give this to you, Monica, and congratulations in advance on your service as board chair. We're very lucky to have you.
Now, we still have to have a motion in a second before we, Supervisor Cummings.
I'll make a motion to approve. Oh, I'm sorry, you're going to make some comments first.
Thank you.
I'd like to make the motion.
Well, first, I just want to thank Chair Hernandez for his year serving as chair on the board. It's never easy, and we managed to make it through somewhat unscathed for the most part. I just want to welcome Supervisor Martinez to serve as chair. Definitely going to be an interesting year ahead of us, but I'm sure that together we will all be able to figure out how we can best try to reach consensus and get to a place where maybe we're not always happy with the decisions that are made, but we're doing the best to try to represent our community. And so I'll turn it back to Supervisor Serpa for the motion.
Thank you. I'll make a motion to approve the chair, Monica Martinez, and the vice chair, Manu Koenig.
Second.
Before we move on to the motion, roll call vote, I do have something to say. As I pass this gavel to our new chair, I want to wish her every success and let her know that she has our full support of the board. I also want to thank my fellow board members, all the county staff, all our constituents of Santa Cruz County for the opportunity to serve as chair. And as mentioned before, especially during these tumultuous and uncertain era that we're going through. Well, the term included some very difficult moments. I'm proud of the positive progress we made together for our community. So thank you. I will now pass the symbolic gavel. Oh,
we got to vote.
We got to take a vote. Getting ahead of myself. I'm ready to pass the gavel. Just kidding. Madam Clerk.
Supervisor DeSerpa,
Aye.
Cummings.
Aye.
Martinez.
Aye.
Koenig.
Aye.
And Hernandez.
Aye. Motion passes unanimously. We move to the right. Okay. This is mine.
All right. Next up, we have item number 8, Consider annual report detailing 2025 Future of Public Health Initiative Work Plan progress, leading causes of morbidity and mortality in Santa Cruz County, and key county health disparities, a presentation from the Health Services Agency. I'm going to invite our speakers to come present on this item. But before we hear from staff, I just want to advise how I'll be proceeding with this item. We're going to hear a presentation from staff, and then I'm going to turn it back to the board to ask questions of staff. Then I'll be opening it up to the public for comment and then bringing it back to the board for deliberation and a motion. So with that, I believe we have here to present Director Connie Morena-Peraza, our Director of County Health Services Agency. We have Dr. Lisa Hernandez, our Public Health Director, and we have Pam Connolly, our Public Health Manager. Go ahead.
Good morning, Chairperson Martinez. Congratulations. And members of the board, Connie Moreno-Peraza, the Director of Health Services Agency. I am very proud and very honored to be here with our amazing team in public health to share with you some very critical information from our communities and some of the great work that we're going to be planning to do in the near future. This department is very critical. They have very critical functions that helps us with the health and wellness of our communities. So I'm very thankful to them, and I will pass it over now to Dr. Hernandez.
Good morning. That's fine. Okay. Good morning, Chair Martinez and members of the board. Thank you, Director Moreno-Peraza, for introducing us and giving us a little props in terms of our work. Oftentimes, public health is successful when you don't know about the work that we're doing. So I do appreciate that introduction. This presentation is part of the annual reporting requirements for the Future of Public Health Infrastructure Grant funding. And the requirement of the grant asks us to describe the leading causes of mortality and premature death in Santa Cruz County, and also highlight disparities across populations. This presentation is intentionally high level due to the amount of time that we have today. We could spend hours talking about this subject and the associated social factors contributing to the data that you'll see in the next few minutes. There's an accompanying annual report, as I mentioned, that goes deeper into the data and trends and context. And if you are even more curious, you can look at the community health assessment, which can be found on the web at DataShare Santa Cruz County. Public health serves as a provider of health status information and is a central partner in convening and coordinating cross-sector efforts throughout the county to address the key issues impacting our community. And we work alongside our agency divisions, as well as community organizations, healthcare systems, and other stakeholders. And we are grateful for their continued partnership and shared commitment to protecting and improving the health of our community. These two graphs show all-cause mortality rates by race and ethnicity over time and in the most recent 3-year period. And before I go into the data, I want to make a brief note on the, what you see in front of you. Death rates are age-adjusted to account for differences in age distribution across the racial and ethnic groups, and multiple years are combined to show broader patterns over time. The volatility in the Black population trend that you will see here reflects the relatively small population size, where small changes in deaths can produce sharp spikes up or drops down. On the left, the trend data show persistent differences across groups. The Black population in the blue line has the highest mortality rates throughout the entire period, reflecting a long-standing and significant health disparity. The white population in the bright green is the second highest rates with an early decline, and it's very subtle on the slide, but there is a decline, and then relative stability after that. The Latino and Asian populations consistently have lower mortality rates throughout the period. Latino rates remain generally steady with limited fluctuation, and the Asian population death rates are the lowest overall, generally are stable. However, you see there is a sharp drop early on, likely due to, again, the relatively small population size in our county as opposed to an actual change in the risk. So just wanted to show that to you. On the right, this shows the data for the period of 2021 to 2023. And again, the differences remain in terms of the differences in terms of the race and ethnic groups. Mortality rates are highest among Black residents, followed by white residents. And again, Latino and Asian residents continue to have the lower rates. Together, these graphs demonstrate longstanding disparities in mortality by race and ethnicity, and they illustrate clear patterns and trends over time, but they do not really show the underlying causes of why these differences exist. And those are shaped by broader social, economic, and structural factors. And quite honestly, it's what we see nationally. So it's not unique to our county or even our state. This slide shows the 5 leading causes of death in Santa Cruz County in 2024, and this is a death count. And you'll see that Alzheimer's disease, stroke account for the highest number of deaths in our county, followed by ischemic heart disease. Drug overdose continues to be a major contributor to mortality, and that underscores what we know is impacting our community and nationally, the ongoing opioid crisis. Though we have seen drops in deaths, fortunately, it still is a major contributor to our deaths that we see in our community. Hypertensive heart disease also represents a significant share of overall deaths. In total, we had 1,941 deaths in our county. And what you see here is that there's an continued importance for chronic disease prevention, age-related health conditions, and of course, substance use prevention. Next, I want to look at a little deeper in terms of our death indicators. And we need to look beyond our death counts and not just our numbers, but also looking at the true burden disease in our community. In 2024, drug overdose is a leading cause of premature death. So now we're not looking at death counts, we're looking at premature death in our county. And when we look at that, we see overdose as number 1, alcohol-related deaths, road injuries, ischemic heart disease, and suicide as those causes. They rise to the top when we examine premature death using what we call years of life loss, or YLL, because these conditions or deaths disproportionately impact younger population, middle-aged population in our community. YLL measures premature mortality by accounting for the age in which a death occurs. So a death at age 25 represents 60 more years of life loss than a death at age 85, helping identify where we're seeing the greatest loss of potential life that occurs in our community. Now I want to take a closer look at YLL, and this graph is, you'll see in the following slides, these are snapshots from our dashboard that our population health team puts together, and I would invite you to speak with us more, or we could present at another time deeper and go through these slides, this dashboard a little bit deeper. It's better when it's interactive. That's what I'm saying. So what you see, though, is that we've lost nearly 12,000 years of life lost across all causes of death in 2024. And when we look deeper, and that's what these different graphs show, you see the highest burden is seen among white residents, males, and adults aged 35 to 54. What stands out, though, I want to look deeper in this part, is that injury, not chronic disease, is a dominant driver of premature loss in our community. and it accounts for nearly half of all years of life loss, and it exceeds cancer and heart disease combined. These injury-related deaths, including overdose, traffic injuries, suicide, are largely preventable. These deaths occur during the years when people are raising families, contributing to the workforce, and supporting community life. The loss is not personal and familial. It represents a loss of knowledge, stability, and social contribution across our county. Finally, there is a health equity disparity evident. Although Black residents represent a very small share of our county population, they experience disproportionately high burden of years of life loss. This mirrors national patterns and reflects persistent impact of racism and other systems of oppression. Now, let's just look at each of the specific causes for years of life loss in more detail. So this slide shows premature overdose deaths, and we see the highest burden among white and Latino individuals, males, and individuals aged 35 to 44. Premature alcohol-related deaths are concentrated among white residents, males, and individuals aged 45 to 54. Premature road injury deaths are predominantly among white residents, are over 90% male, and are concentrated in individuals ages 25 to 34. And for more information on road injury, please see the 2014-2023 Santa Cruz County Crash Report that was released in July of 2025. Just wanted to give you a little bit of encouragement to look at that report that was released by Public Health earlier in 25. There we go. Years of life lost due to heart disease primarily affected white and Latino residents, males, and individuals aged 45 to 54, closely followed by those aged 65 to 74 years of age. And one note, years of life loss is using the benchmark of death that occurs before the age of 75. So that's why you will see that mentioned sometimes in my presentation. Well, suicide-related years of life loss were driven primarily by deaths among white and Latinx residents, males, and young adults aged 25 to 34. The next highest impact in those aged 20 to 24. And one thing that you might not be able to see, but I want to call attention to it, is again another disparity, that the percentage of reported years of life lost by race, ethnicity, we see a concerning data point where individuals who identify as multiracial make up about 3.85% of our population. However, they represent 16.7 of years of life loss. So again, we are seeing that burden in that community when we're looking at race, ethnicity, or suicide years of life loss. Now I want to show you here how HSA is strategically allocating our resources to address the leading of causes of premature death that we just reviewed here. Our agency uses a comprehensive coordinated approach across 3 divisions: public health, behavioral health, health centers, rather than working in isolated manner. Drug overdose is addressed through multiple efforts. Our opioid settlement funds, which you are aware of, is used to support community programs and evidence-based efforts, including prevention and system-level responses. Treatment for substance use disorders is available through our health centers, the behavioral health division, and its contracted providers, and of course, other providers in our community. Public health also maintains overdose dashboards for real-time monitoring and provides upstream youth prevention and early intervention efforts. Alcohol-related deaths are addressed through the same integrated substance use treatment infrastructure, and public health youth-focused upstream interventions address the shared drivers of substance use that also we see in alcohol-related deaths. Public Health leads safe and active transportation programming with county and community partners to address road injury. And this cross-sector approach supports safer systems rather than relying solely on individual behavior change. For ischemic heart disease, our health centers provide primary care, focus on prevention, early detection, and chronic disease management. And Public Health is leading the Community Health Improvement Plan, which has highlighted barriers to healthcare access. Suicide prevention is a collaboration with behavioral health, public health, contracted providers, community-based organizations, and school-based partnerships focused on early identification, prevention, gatekeeper trainings, and focused means reduction activities. As federal and state level changes increasingly affect our ability to provide services, addressing these health conditions and disparities will become more critical than ever. Pam will now provide a more detail in the community health assessment and the community health improvement plan, the federal impacts and public health and other key takeaways. Thank you.
Thank you, Dr. Hernandez. Good morning, Chair Martinez and members of the board. I'm Pam Connolly, the Public Health Manager for the Public Health Division. Dr. Hernandez provided an overview of our county's population, change the slide here, of our county's population data. Now I'll share how we use that data to engage with our community to improve health outcomes. So every 3 to 5 years, HSA conducts a community health assessment and a community health improvement plan. You might recall in September 2024, our Public Health Division gave a detailed presentation to this board, really highlighting all of the components of the community health assessment. In that assessment, and I'll note that assessment is available also on DataShare Santa Cruz County, so if you want to view that report, it can be found there. In that assessment, we analyzed over 300 health indicators to understand our county's health landscape. We completed the quantitative data analysis and complemented that with qualitative insights from focus group, key informant interviews, and other types of assessments that are conducted across our county. We then convened our community members to review this information and identify priorities through a number of facilitated discussions. So this community-driven process initially identified the 4 focus areas that you see here on the slide: access to healthcare, children and adolescent health, housing security and housing burden, and mental health and mental disorders. These were all priorities for improving health that were identified by our community together. I'd like to note that housing security and mental health tied for 3rd place, so we included both of those as priorities in the community health assessment. I'm transitioning now to describe our community health improvement plan strategic elements. Since the assessment done in 2024, we've been using the information, that data analysis, and what we've learned from the community process to develop a community health improvement plan, also known as our CHIP. Our CHIP demonstrates how public health uses data to bring partners together to work on shared health priorities. It's built on listening to community members, leveraging our collective relationships and resources to address what matters the most to residents. Last year, we convened 4 countywide community conversations and continued to gather and analyze information. And through this process, in part due to the federal and state cuts to Medicaid, the community agreed to focus on access to care as a primary strategic element that intersects with the other areas of the community health assessment priority areas. We then did a deeper dive into the data and did further analysis with what we have available to us as available data to identify the most health burdened geographic area in our county. This analysis led to identifying Census Tract 1104.01, which is a community that is on the Pajaro River in Watsonville. We reconvened our community partners so we could look at this data again and go even deeper. Together, we identified that both a geographic focus on that census tract and a priority population being pregnant Latinx individuals and parents of children ages 0 to 5. So for this strategic element of access to care, we're really taking an inch wide and a mile deep approach, concentrating resources in our most health burdened census tract and really prioritizing this population across the full continuum of care. So including OB care, pediatrics, primary care, behavioral health, oral health, and gender affirming care. So this community-driven work is currently in progress. As of yesterday afternoon, we were still doing some collection of information. Our team, in partnership with Ventures, met with 15 families in the census tract to gather more information and understanding what they believe will help improve health for their community. So there will be more to share in the development of this element soon. The other two strategic elements that you see here are Dr. Hernandez presented the mortality data on, and the second is overdose prevention. So having that in our chip acknowledges that the lives we're losing and the complex issues behind this crisis are really important. It recognizes that we've been working across departments, really county-wide, to tackle it, and that this priority brings substance use treatment, harm reduction, and prevention together in a coordinated effort. Including suicide prevention in the chip acknowledges we need to do more in this area. And the Behavioral Health Services Act provides both a framework and an expectation for this work, focusing on youth services, LGBTQ support, mental health access, and prevention programming. So I'm going to switch over a little bit here to just highlight our federal impacts for our local local public health department. We've got the scientific authority has been undermined. We see with the politicization of the CDC guidance and public health science that there's a reduced trust in public health overall and in health services. We've also know that there's a reduced prevention capacity. So cuts to reproductive health and other chronic disease programs really puts our communities at risk, and it makes the work harder when we lose a lot of this infrastructure. We also know that our vaccine schedule changes, unsupported by evidence, really put our community at risk for being under-vaccinated and not able to have the community as healthy as it potentially could be when we're all vaccinated. We also have barriers to care access, so actions really undermining the Affordable Care Act, rising uninsured rate for our most vulnerable populations, and the reduction in preventative and primary care access, including reduced access to gender affirming care, all of which we know are really important for our community to be healthy and whole. We also have seen incredible weakened health equity programming because of the rollbacks of disparity funding or fundings for disparity work and disparity reduction programs. So we've got diminished data collection and also diminished data collection for our vulnerable population. So we don't know everything that's happening for our populations because we've got reduced data collection happening across the board. Lastly, I will just give some key takeaways. We've done a lot of talking, we've shared a lot of data, so I just want to highlight the few things that we want to make sure you take back with you. So first, our data shows that health disparities persist in Santa Cruz County. Mortality rates vary significantly by race and ethnicity, with Black and white populations experiencing higher rates, while Latino and Asian populations have lower rates. These disparities drive our focus on health equity. When we look at premature death through years of potential life lost, drug overdoses emerge as the leading cause, while chronic disease drives overall mortality in our aging population. Injury deaths occur at younger ages, representing significant lost potential in our community. Our community health improvement plan is community-driven and strategic. We're taking this inch-wide, mile-deep approach, concentrating resources in our most health-burdened census tract, while also addressing overdose and suicide prevention, which you heard about in Dr. Hernandez's mortality data. The work requires integration across our agencies, so public health, behavioral health, and health centers, our one HSA, are working together with community partners to address these priorities. We've got coordinated efforts and coordinated strategic operations across these areas. Finally, we as in public health are committed to accountability and transparency. So we will be providing an annual progress report on our community health improvement plan. continued information around health data in our community, and just to ensure that we are transparent and sharing that we have our, that we are doing data-driven adjustments to our strategies as we continue the work. Thank you, Board, for your continued support for public health and the health of our community. Please let us know what questions you have.
Thank you for the presentation. I'm now going to turn it back to the board to see if there are any questions for the staff.
Thank you for this presentation. I do have a couple of questions. Some of these reports that you've referenced are very comprehensive, and I'd like to be able to look at the crash report from July and a couple of the other reports you referenced. Are those readily available on the website under the public health section, or?
Yes, they should be on the HESA website. If you go to public health, you can see a link both to the community health assessment and to the crash report.
Okay. Thank you. So in a board action a little earlier this year, we had to make some reductions across our health services agency, and one of those positions was a suicide prevention coordinator or program manager. I can't remember exactly. But given the data that I see in front of me, I'm concerned, and we all should be very concerned, that these prevention efforts we need to put into high gear, I think. Can you speak to, now that we have this data and we've analyzed it, what are some of the prevention strategies we'll be using and implementing in our community?
We're just trying to figure out who can answer. I think we can all answer. Yeah, well, what I will say about our current suicide prevention program is we in public health are partnering with the Behavioral Health Division, and there is work. We've got a position, when that position that you spoke of ended, what we did is we had someone a senior health educator in public health, that we had some capacity to move into completing some of the work for the grant that ends at the end of this year. And we expect that through the Behavioral Health Services Act, that there will be money coming from CDPH for suicide prevention. So we are poised, we're continuing the work, we're holding those threads, and we're poised to continue the work once we understand what the allocation will be from the state and what the expectations of that funding will be.
And I think there's been an effort, over the last decade or more to really look at young girls, essentially, in our schools and our communities, and to give them some services to help them in STEM and Girls Inc. and different curriculum out there to help young girls with self-esteem and confidence, and making sure that they're, on that, give them lives they don't have early in our actual strategies that you're thinking about implementing. And maybe today's not the right time for that. Maybe you could come back with that if today's not the right day.
Happy to share that at a later date. And I'm sure my colleague, Dr. Marnie Sandoval, can help with that. But I will say that we are waiting, of course, to understand what the state expectations for the allocation is. But we also know that we are a responsive health department, a responsive agency, and we'll make sure that we are touching everything that we can when we understand what those expectations are.
Thank you.
Supervisor Koenig.
Thank you, Chair. One of the things that jumped out at me in the report is just how much traffic injuries actually are one of the leading causes of preventable deaths. And, I went back and I'm looking at the crash report now, and also checked the Office of Traffic Safety for the state's rankings, and was shocked to see that I think we advanced to the worst county in the state for bicycle injuries and deaths. And I wouldn't believe that if I didn't actually know so many people that have actually, I can just think of 3 right off the top of my head, 1 who died and 2 who have had sustained serious injuries on bikes. I'm just curious, do you in public health work with Public Works at all on ways to prevent if you're seeing problem areas where we see repeated injuries or crashes? Are you working with Public Works to identify solutions and engineering fixes?
Public Health has a Safe and Active Transportation Coalition. I don't know if Public Works is part of that group. So we can come back to you and let you know. Seems like the director is standing up and can answer that. So I will hand it over to Director Machado.
So to answer your question, oh, there we go. Thank you. We are a part of the Vision Zero program with health. And we actually teamed together and received a grant from the SS for a federal program. And we're developing an action plan right now, which that will identify all the challenges and all the areas of needed improvement. And then once that plan is approved, we'll be eligible for implementation of those individual needed projects and programs. And it's not all just projects. Some of it is, more education. Some of it's working with public safety, with the health groups. And so it's a lot of different programs that we'll be investing in through federal implementation grants. So it's on our radar, and we're pursuing all avenues we can to address the very concern that you raised.
It's the title of that is the Vision Zero Action Plan, or
it's called it's an action plan. Let me think of it. I don't think Vision Zero is in the title of it, but it is it is an action plan. I can get you more information. I can get you a copy of the draft that our consultant is drafting now. I'll send you some information on it.
When do we anticipate it being finalized?
It is being, I don't know the date of when it'll be finalized, but I'll get you that information as well. We'll include it all.
Thank you very much.
Thank you.
Supervisor Cummings?
Oh.
Thank you, Chair. I'm just going to piggyback a little bit on Supervisor DeSerpo's comments, because, the data that you showed regarding, the white and Black populations and males within the community experiencing the highest rate of mortality. I'm just curious what strategies might be considered or implemented to help reduce the mortality rates amongst those populations. And in particular with the Black population, Black residents make up about 1% of the total population of Santa Cruz County, which is like 2,500 people. That seems like a pretty easy population to be able to target, given the resources that we have, since there's so few people who make up that population, and yet there's so much higher mortality amongst them. So just curious across those demographics, what might be implemented or considered in terms of trying to help reduce those rates of mortality.
Thank you, Supervisor Cummings. It's actually less than 1%. It's a very small population. So I understand your what I would say is almost a directive to work closer with. There are community organizations in the county that we need to work closer with. And when you do a deeper dive in the data for premature death, the two areas where Black African-American population seems to have the highest loss in premature death is one, ischemic heart disease. That's one thing that's not a surprising one, but the other is drug-related deaths. So we do need to look at those two areas and focus and work with our community providers for that, for those, especially those two areas. And that's that.
Thank you.
Thank you, Supervisor Hernandez.
Thank you. Well, first of all, I want to thank Pam Conley and Connie Moreno and Lisa Hernandez for the presentation. Kind of piggybacking on Supervisor Koenig's comments with the road-related fatalities. In my district, District 4, it does represent an area that per capita has the highest number of fatalities and serious collisions in the state as well, for Watsonville. So I look forward to all the work that's being done with Safe Streets and the work on the county's Vision Zero plan, which is led also by the Health Services Department as well. Hopefully we can do more things like there's different places like in Oregon that are working on lowering speed limits, which is a proven tactic to save lives of both pedestrians and drivers and bicyclists altogether. And of course, the need for sidewalks in parts of our districts, dedicated bike paths, and of course, the flash beacon crosswalks. I think all those contribute to saving lives of both pedestrians and drivers alike. So hopefully we can work on that and have a presentation sometime in the future about that, because it is significant that we do have the county and one of the cities with the highest fatality and serious collision rates in the state of California.
Thank you. I just have a couple quick questions. One, can you speak to the drug overdose trends over the last few years? I thought I had heard that they had gone down, but what do you think is contributing to that?
Yes, they have gone down, thankfully, and I hope they continue to decline. It's a multifactorial I don't want to call it a success, contribution of that decline. One is that we are seeing lower amount of drugs coming into our community, and that started years ago, before this current president. We did see that coming. So that was a longstanding campaign. So that's one thing. The other thing I really want to talk about, not only our MAT treatment that we have, our medicated assisted treatment in our community, our health services agency, health centers, behavioral health, and our providers in the community truly have stepped up to work with our community to provide that level of success. And last but not least, Narcan. Narcan, as many of us know, naloxone helps to reverse drug overdose, and it is life-saving. And it is throughout our community, from schools to law enforcement to individuals here in our community. I have one on my person. I gave it to my children, so they have it. And that is basically the culture of our community in terms of providing that level of life-saving efforts. I don't know if anyone wants to add to that, but that's what we are seeing.
I think the other thing I wanted to just add, I know Dr. Sandoval's in the audience. I know behavioral health, having substance abuse under that division, have been very, very active. And what I appreciate the most about this decrease, even though it's too many still, one life loss is too many, right? One overdose too many. A lot of the work that she's been doing as well with a lot of the treatment, availability of services also for the young people as well as our adult. And then I think also the education that has been happening has been just tremendous, and it really, really helps. The way that you administer Narcan is very easy. You can see it in YouTube. And that easy way to do it has really encouraged a lot of folks to carry it on their purses or their backpacks and utilize it and help us save lives. So it does take a multi-department, multi-community-based approach to reduce these numbers.
Thank you. I would now like to invite the public to comment on this item. If you intend to speak, I ask that you please line up so we can get a sense of how many people intend to speak on this item. And if you're participating via Zoom, please use your button to raise your hand or dial *9 if you're on the phone. Clerk of the board, how many people do you see online?
Chair, currently I see one speaker, and just to make sure everyone online is able to connect or indicate, I believe it may be *6 to raise. Wait, no, I'm sorry, you're correct. *9 to raise your hand, and then *6 to mute or unmute yourself. You do see speakers continuing to raise their hand online. We now have 3 people in line on virtually.
Thank you. And it looks like we have about 6 or 7 speakers That being the case, I'd like to set the comment period for 2 minutes each. Go ahead.
Okay. Yeah, go. Okay, speaking of course on the lithium ion batteries, storage facilities. Can you hear?
Wrong item.
Oh, okay. Okay, speaking on the lithium ion battery storage facilities.
Ma'am, sorry to interrupt. Right now, we are speaking on item number 8, which is the presentation that we just heard, and we're accepting
I'm
comments on
sorry.
that
I
item.
thought, yeah, I've got an appointment down in the South Bay and I've got, okay. I would, on the health of the community, I've spent decades in the healthcare, and I want to say that I think the big elephant in the room that we're missing is nutrition. Nutrition, good, healthy nutrition. If we could allow everyone in this community to have access to organic produce, hopefully if they eat meat and chicken, instead of all the chemical laden stuff, the gut brain relationship, we'd see less crime, we'd see less depression, the suicides. They probably wouldn't go so much to drugs, alcohol. That's very important, nutrition and environment, a clean environment in their home, in their backyard. We need to rid the pesticides in this community. There are xenoestrogens, and they are known to cause hormone cancer, it's breast and prostate. And we need to make sure that everyone knows to get out in the sunshine, to earth. Earthing is actually science now. Walking in the sand barefoot, we have the salt from the ocean. Very important, simple concepts. Some mind practice, meditation, a Zen mind practice, so that they can kind of go internal. We're looking externally that, you know, our medical communities are going to fix everything. It's an inside job. And if every child could have a little meditation in the morning when they first entered school and just calm themselves down, I mean, they're loaded with energy and their hormones are flying off the chart when they're teenagers, and they're impulsive. They get in the car and go home and, you know, fly across the highway 1 and 17. I mean, I think we could really, really take care of things. Now, you can't patent these things, so you don't hear about how wonderful they are, but they are. Also,
thank you.
Oh, is my 2 minutes up? Okay, thank you.
Corel Reader from Corralitas. I have to say that mental health and suicide prevention kind of rose up to the top of my priorities last week when I had a conversation with one of my dear friends who has a 12-year-old son. And she informed me that he had, about 3 weeks ago now, maybe 4, he had written on one of his papers that he turned into his teacher, thank goodness, that he didn't want to live anymore. He was hoping somebody would unlive him. And I was kind of shocked and horrified. I know this young man. He's a very wonderful young guy. And we know that the youth have a lot of complex issues and pressures on them now. And there's no one cause for why a young man like him would have suicide ideation. However, one of the causes that she and I discussed that was probably pretty prevalent in his thinking is bullying in his school. And I'm just hoping that somewhere in your list of projects and ideas that there is a way to maybe, first of all, raise awareness of educators, classroom teachers of all levels. He's only 12, not even in high school yet. And give them tools to help young people, help them spot bullying, help them curb it. And then second of all, give programs for young people who are struggling to have a toolbox to help battle bullying. Because we can see that this is maybe the straw that broke the camel back in his case. And I'm hoping that there's some way that he will fight this and become a, you know, healthy, mentally healthy young man. But please look into that.
Thank you.
Good morning. My name is Ana Ventura Ferris, and congratulations, Supervisor Martinez. I'm in your district. Used to be in Felipe's for a million years, so I love the whole county. But I'm here today because I am on the board of Janus, the leader in addiction treatment in Santa Cruz County, and I have seen the tremendous growth and work that they have done across the board for all people throughout the county. Open access anytime to come in to receive treatment for alcohol and substance abuse. So I was going to speak a little earlier because you approved an agreement for Janus to continue our work, but it turned out even better because I got to listen to these wonderful professionals here in public health talk about the importance of working in the communities to let them know that it is a disease, just like any other chronic disease. When you get to addiction in drug or alcohol abuse, there's a lot of medical evidence behind that. In Janus, we have a medical team, we have a doctor. I've been learning a lot about it. And you are right, the loss of life of people that are young and should be still living and still be with their families is important for the health of a family and the community. So I want to thank the county for being a wonderful county government department that works with your partners, including us, Janus. And stay tuned, we have a lot more to expand our services from, especially in Watsonville. So thank you so much. Thank you, County Board of Supervisors, for continuing to support us. And I just want to say the last minute, Narcan, we've been working hard with that, spreading that everywhere. And we are pleased with the almost 60% plus decline of fentanyl. We've been working hard on that too. Thank you so much.
Good morning. My name is Elaine Salter. I live in Ben Lomond, and great job. You guys are working really hard. Thank you for the report. I too worked in addiction treatment for 30 years. And am very grateful for Narcan being available. I just wanted to say thank you for speaking specifically about having it ready, available for everybody. Both my teenage daughter, my granddaughter, she's my teenage granddaughter. Everybody has them in their cars. I have 2 in my truck. I bring them everywhere I go. As a community, the only way we're going to be able to get back our population is to be educated about things. The other thing I wanted to speak to is our roadways being the Indianapolis roadway. I live right on Highway 9. I have a crash in front of my house probably at least 4 times a year. I live on a curve. I've seen things, I'm a first responder too, so I've actually had to hold pressure on people. That's one of the things that I think that is contributing to the accidental death is, people are actually using our Highway 9, Highway 35, Highway 17 as their, playground. And so I don't know how you combat that. But Department of Transportation, maybe that's part of what you guys get to figure out as well. So thank you guys for all your hard work. I appreciate what you do.
Thank you.
Good morning, Becky Steinbruner. I'm a resident of rural Aptos in District 2. With all the talk of Narcan, I think it would be negligent not to request again a pilot project here in the county of Santa Cruz using ibogaine. It is a very effective treatment that removes the addictive qualities that a person has. It's been shown effective around the world. I have a personal friend that was in the homeless communities, and his girlfriend was able to give him some, and he is now drug-free, alcohol-free, and a very productive member of society. Please consider initiating a pilot program using ibogaine in Santa Cruz County. I heard nothing in the report about veterans, and that troubles me because I know that's a huge sector of suicide, drug, and alcohol problems. And we've got to do more to help our veterans. That's another community we should be focusing on, regardless of the color of their skin. For suicides, I have had friends, unfortunately, commit suicide, young and old. The common thread was isolation and feeling of hopelessness. It has been shown many times that community garden spaces are very good places for people to come together and connect with each other in a personal way and not on a screen prone to bullying. So especially as this county is about to explode with RENA number building, make sure that there are community garden spaces required to be included in any and all spaces. And addressing e-bikes, that is another issue that we must do with distracted drivers as well. Thank you.
Good morning. My name is Carol Bjorn. Thank you for the presentation today. And I wanted to piggyback off of what Joanne said and also what Becky said. So one thing that wasn't mentioned in the presentation was toxins, and Joanne kind of touched on that with the food and nutrition. But we get toxins in our environment quite often through the air, through the food, through pharmaceuticals, honestly. And so we need to be detoxing regularly and having a more clean environment, more clean food. A lot of the illness, a lot of the mental illness is because of the toxins. And so if we could just detox, that would be really a preventative practice, which is, it would be great to start focusing more on, or as much as we can, focusing on preventions. And I know a lot of what you do is a safety net, which is wonderful. But if we can also include more like preventative, like the community spaces that Becky mentioned. And also in the presentation, it looked like the two groups, the Hispanic and Asians, were the lowest mortalities. And it could be because those two groups have a great sense of community. And there are books on longevity and so forth, and people that feel like they have a community and they're supported tend to live longer. So I would just propose that as a way to prevent illness and disease. Joanne also mentioned mindfulness practices like meditation. I just also want to point out Qigong is a very amazing proactive preventative practice. It's actually known as the art and science of prolonging life and preventing disease. We have a Qigong master here in Santa Cruz County. His name is Lee Holden, and he has many teachers throughout the county that regularly teach Qigong, often in parks, in the community spaces, sometimes indoors in the winter. But that's also a great way to prevent disease. It's also extremely helpful for addiction and mental illness. So those are my ideas. Thank you.
Thank you. We will now open it up to speakers who are on the call. Just as a reminder for those speakers, we are currently on item number 8, the Future of Public Health Initiative. So please keep your comments to number 8.
Call in user 1, your microphone is now available.
Thank you to the public comment I just heard, and I would like to see this report expand to causes of ill health. 3 major ones are pesticide exposure, and if we had mandated ecological, organic agriculture and banning of pesticides, we'd have much better health data in this county and elsewhere. Another cause of people's sickness is radiation exposure from wireless technology. And I'll read you a little bit from Arthur Firstenberg's Cellular Phone Task Force. Microwave radiation exists in nature only at levels billions of times lower than is emitted by any of our wireless devices. And pulse digital frequencies do not exist at all in nature. We evolved without them, and they interfere with our life force. Because people are irradiated by their cell phones day and night, even when turned off. People do not know or recognize that their phones are doing to them what they are doing. They think their trouble sleeping, their body aches, their tinnitus, their unstable blood pressure, their memory loss, their hair loss, hearing loss, and their vision loss are normal. And that cancer, diabetes, obesity, or heart disease are due to, in quotes, something else, unquote. We should be removing microwave radiation sources. The third problem is vaccines, which are toxic, even in a decision of the Supreme Court in 80s.
Bernie, your microphone's now available.
Good morning, board, supervisors. Happy New Year's and congratulations, Supervisor Martinez, for taking up the helm of this board, and look forward to your leadership. This is Bernie Gomez with Milpa. You know that I've always thought of public health as a critical component to create actual public safety, and strategies and ideas, those are always going to come. They're always going to have to evolve, right, and be redeveloped, because the impacts of poverty, right, of the unmet social determinants of health are always, even though they stay the same, but they're always changing, and they change in the way it impacts people. Some people might start doing good and maybe in their physical health, but they start facing housing insecurity, which creates mental health instability, and so on and so forth. So those strategies, I think, are best met when you bring people together, when you bring like para health centers, local, which I consider local organizations that are working directly with people being impacted, right? As such, coming together and just the strengthening the fabric of the health sector here in this county. I know that in this county and most counties probably, that the largest contribution from the general fund is not to the public health center or the public health departments, right? And I think that's something that the county can do, is restructure the way it's spending money right now based on the impacts of the federal tax on the health sector. So just making this county priorities, prioritize the public health sector. Thank you.
Beverly, your microphone's now available.
Good morning. My name is Beverly Deschaux, and normally you hear me in another context, but I'm a retired therapist. And first, I have a question about the report. Great report, by the way. I have a question about the lower rates in Latino, the health issues. And I'm wondering how much it has to do with lack of reporting, in fact, that maybe people are not coming for health care to have their status registered, possibly because of immigration status. I don't know, but I question that. Regarding bike lanes, great topic. I think the only way that is going to get handled is not by having us riding our bikes beside cars who don't pay any attention to that we're there, and is to have them be separated. And one solution that occurs to me is using sidewalks as bike lanes, because I don't see people walking except downtown. So that might be a solution. I myself was knocked off my bike twice, and once very seriously. And 30 years later, I'm still experiencing problems. We never have enough mental health services. We just don't. And suicide relates to substance abuse, and substance abuse relates to, they go back and forth. People don't come for substance abuse, in my experience. They come for other issues, and I might have detected it. Bullying. My daughter was bullied, and when I spoke with her teacher about it, she was coming home crying every day. Her teacher said, yeah, that's just how kids are. 70% of our emissions in the county come from vehicles and other fossil fuel related things. So those are serious health issues that we need to.
Guest user, your microphone's now available.
Yes, hello. And I also would like to hear about the Corrupt Mind program. I think all educated people are aware of that program, and this is a huge, dangerous issue. And when it's also go along with the illegal drugs, this is when it change people and make them look like zombie. I also would like to not see any more homeless people who screaming out loud in public. I think it is a grave disability, visible grave disability. Why those people not taken care of right away? You know, this is, I think it's not good for any vulnerable person to see and hear, and it's a nonsense. It's should be taken care of. And also prevention is a huge issue in our county. There is no actual prevention. And this, I believe, because we don't have legal help. If need the legal help, so no CRLA or senior citizens or ombudsman will help. And ombudsman is a great issue right now. It seems like it's also run by criminals. It does not do their job at all. I would like to ask the public health and the health service agency to look into that and do something about it, because we do not have ombudsman in this county. So please, accountability also is necessary. If the people do not hold accountable, so the issue will coming all over again and again, and just will grow up. Thank you.
Thank you.
We have no further speakers online, Chair.
Thank you. I'll now turn it back to the board for a motion or discussion.
Chair, I just wanted to discuss one topic a little bit more, which is food. It was mentioned by one of the speakers, and really it is sort of a subtext through both leading causes of death and leading causes of premature death. Perhaps most obviously leading cause of premature death is ischemic heart disease. I think that there's a pretty strong correlation between an unhealthy diet and a heart attack, which ischemic heart disease is. And then even on leading cause of death, Alzheimer's disease has been called type 3 diabetes. I don't know if that's entirely appropriate, but I mean, it does sort of suggest some of the current research on this topic. Heart attack still up there as a leading cause of death. And, arguably even things like suicide or drug use could be influenced by poor diets. If people felt better, maybe they wouldn't turn to drugs in order to try to self-medicate. I'm just curious, what are some of the current thinking within the department? Do we have any programs or policies that really support healthy eating within our community? I mean, obviously, we're being called to do more of this with some of the threats to SNAP and food assistance in general. And so maybe there's some natural synergies as the county is forced to take more of a leading role in food assistance that we can also promote healthier eating.
I have to think about that. How do I make this sound positive? One of the things I mentioned and Pam highlighted was the increasing threats to public health. And one thing that is an actuality is that our SNAP Ed funding was cut. So our education, our funding for education for healthy eating, healthier lifestyle was basically taken away from us. So with the rising threats and our new food pyramid that was just presented last week, we're going to face more challenges, potentially poorer health because of federal actions, both in policy and in funding. We do have our health centers, our primary care providers in the community that we will be relying on more and more because they will still see individuals in the community to be, whether hopefully it's prior to worsening of conditions or any diagnosis of the condition. However, it's going to be tough. I don't know if Pam can save me and make it sound any more positive. However, this is where we will call on the community to help us. We have our community health improvement plan, which is focusing on access to healthcare. And as she highlighted in a census tract with essentially the poorest of health. And when you focus on that area, the efforts that we focus on in the quote worst worst health in terms of health outcomes in our community, we will see those strategies help the whole county as a whole. One of the things that I saw years ago that spoke to me at a demonstration was everyone does better when everyone does better, right? So that is really how I see the philosophy of public health. And yes, Supervisor Koenig, it's going to be tough. I will stop here and hand it over to Director Moreno Peraza.
Excuse me. I do want to take that feedback back to HSA and see if through our other divisions, I agree with everything Dr. Hernandez has said, but I think this is a time of crisis where sometimes crisis brings us together to come up with some solutions. Being Hispanic myself, I do know that in some of our different cultural groups, the different foods, the way they're cooked, et cetera, versus going out to eat or buying food, fast food, there are some cultural differences sometimes in how we eat and diet that we can probably learn. I think it was mentioned by one of the speakers as well. But I think there are some programs out there in other counties where nutrition is incorporated, healthy eating as evidence-based practice in other counties that I can discuss with our team to see if our funding allows us to prioritize with our partners and look at it strategically. But as she said, with all the changes that are happening, we have to be very innovative and creative. So we'll take it back and review the feedback. Thank you.
Well, thank you. I would love to hear some more concrete options. It doesn't have to be tomorrow, but at some point as soon. So to that effect, I'd like to move the recommended action with the additional direction that HSA return no later than next year's review of this annual report with policy options to support and incentivize healthy eating for Santa Cruz County residents.
Second. We have a motion. We have a motion from Supervisor Koenig and a second from Supervisor Hernandez. Is there further discussion from the board? Supervisor Cummings?
Yeah, I don't know if this needs to be a friendly amendment, but I think through the discussion, we also discussed ways to reduce mortality in some of the groups where we're seeing the highest levels of mortality. And so I hope that we can also work on that. And hopefully when this comes back, if there's been policies that have been implemented, we can understand how those have helped to reduce mortality amongst those groups where we're seeing high levels of mortality.
Supervisor Cummings, thank you. If I may say, what I'm learning in the community, for the short time I've been here, is they really want information. So I might be partnering with our team here and see we can set up a process to really go out in the communities and share this information and open it up for their ideas and suggestions. Because sometimes the answers are in the community. Our partners have a lot of answers. So I'm learning more and more the importance of HSA and particularly Public Health, who's such a critical division in HSA. They do amazing work that with this presentation, I got very excited for us to go out there and find some solutions. I know we're in a financial crisis or starting one, but I do think that we're going to go through some of these processes and hopefully come up with some solutions. But we will definitely take all that feedback, Supervisor Cummings.
Thank you. And as my final comments, I just want to thank the staff for this really important presentation. What you're sharing, I think, should ground the conversations that our board has around strategic planning. As a board, we have really endorsed the idea of health in all policies. And every day, policies come before the board, whether it's related to road, infrastructure, our social services, our allocation of resources that have an impact on overall health and overall longevity of our community. And so what you presented today is really important and will help us ground our conversations as we make difficult decisions and directions in the coming year. So thank you so much. We have such a competent public health team, and I'm very privileged to be able to work with all of you. Thank you for being here. So with that, we have a motion and a second. And with no further discussion, I'll ask the clerk to call the roll.
Supervisor Cummings,
Aye.
Hernandez,
Aye.
Koenig,
Aye.
DeSerpa,
Aye.
and Martinez.
Aye. Motion passes 5-0. So before we move on to the next item, item number 9, I'm going to call a 5-minute recess. We will return at, actually, let's just return at 10:50. I'll now call item number 9. Consider principal components of ordinance allowing for the development of energy storage system facilities in the unincorporated area. Direct staff to conduct environmental review of the potential ordinance under the California Environmental Quality Act and take related actions, an item submitted by Community Development and Infrastructure. So as we go forward with this item, I would just like to take a moment to clarify what we are discussing today. Primarily today, we're discussing the proposed draft amendments to the general plan and the county code in alignment with board direction given at our meeting on November 18th of last year. The recommended actions also include direction to staff to conduct the environmental review and work with the Agricultural Advisory Commission and Planning Commission in order to return to the board with recommendations for adoption of an ordinance no later than November of this year. What we're discussing is an ordinance that would apply to any energy storage system brought before the board. And I realize that we've received a lot of public comment and feedback regarding a specific potential energy storage system on Minto Road. But the item before us today is really focused on the ordinance itself. So I just want to clarify that as we call this item. As a reminder for process, I'm going to invite staff to present on the item. Then I'll ask the board for questions to staff. I'll then invite the public to share their thoughts on this item and then bring it back to the board to have an opportunity to discuss and provide direction. So with that, I would like to invite Assistant Director of Planning, Stephanie Hansen, to present the item.
Good morning, Chair and Supervisors. Stephanie Hansen, Assistant Director, Community Development and Infrastructure. As the chair mentioned, today we're going to be presenting mostly on the changes to the ordinance as a result of the board's direction at the November 18th meeting. This was their direction after hearing public testimony at that meeting. And also at that meeting, we spent a great deal of time kind of going back through the purpose of an energy storage facility, the needs, the benefits in terms of climate change and reducing greenhouse gases and allowing for more resiliency in our electric grid. And we also discussed the potential locations of the combining district of that modification to the zoning map. So I'm not going to spend too much time on any of that today. We're focusing on the board's changes. And again, to reiterate, this is not a project specific presentation or item.
on any specific project, including this facility in Watsonville. That will have a separate set of considerations and hearings in the future if the board decides to move. Before I start, I'd like to thank County Council for their
Ms.
diligence.
Hanson, can I ask that you speak closer to the mic, please?
Sure.
Thank you.
Before we continue, I just wanted to thank County Council for their diligent work on the ordinance revisions. So I'm going to review kind of the revisions that have been made since November 18th. These are in your packet and the changes are highlighted in yellow for ease of locating them. In addition to the provisions that were already in the draft ordinance, we added numerous safety standards. These include a 300-foot setback from battery modules to nearby residences, requirement for a perimeter access road for fire that includes 2 entries to the site, as well as enough room for turnarounds, which would be determined by the reviewing fire district. Requirements for the use of best available technology that minimizes the risk of thermal runaway, which is, of course, the fire incident, the likes of which happened at Moss Landing, in which multiple battery modules caught fire. This would include a comparative analysis of available technologies, hazardous chemicals, and risk of thermal runaway. In the area of resource protection, we also made changes. These include to the replacement ratio required for impacts to commercial agricultural land. In the previous draft, we had a 1-to-1 replacement ratio for impacts to commercial ag land. This has been retained, but due to concerns over feasibility, cost, and timing, staff recommends that additional provisions that would allow for replacement at a 3-to-1 ratio also include protection of other resource lands. These options include non-commercial agricultural land, timberland, or habitat. Provision for a catchment system has been added. This is in addition to the normal stormwater runoff requirements already required by code. The catchment system would be designed to capture all the water and chemicals used to combat an emergency incident in order to protect surrounding lands and waters. We have also added soil and water pre-testing and monitoring, in addition to the previous provisions for air quality monitoring. We also address community benefit in the ordinance revisions. In addition to what was previously in the ordinance, we added stronger language for bonding, insurance, financial guarantees, including the reimbursement of damaged parties in the event of an incident. We clarified that any training of our fire district and other responders is paid for by the energy storage operator. For energy storage facilities carrying the risk of thermal runaway, financial mitigation in the form of annual contributions for fire equipment, training, and radio interoperability are also required. We added requirements for skilled and trained workforce as defined in state law. And we also added references to the county's general plan noise standards. Changes related to operations include additional security measures, such as non-scalable fencing and signage and a fully monitored security system, a dedicated water supply, submittal of a detailed decommissioning plan that includes a plan for battery disposal. And the board's direction also included addressing the issues raised by the City of Watsonville's comment letter. And these largely concerned safety and community outreach. The safety concerns are addressed in the revised ordinance. community outreach, both with the public and the city and the responding fire districts, has been ongoing for a year or more. So this chart kind of addresses the different phases that we would be entering in if the board decides to move forward. We identified some of the kind of overarching issues in the first column, including community benefits, safety, infrastructure improvements, and environmental protection. And then in the second column, you can see what the ordinance addresses in terms of requirements and guidance for new systems. And then we would move into the environmental review phase. We're potentially looking at a supplemental environmental impact report that would address the relevant potential environmental impacts of any new facility located in the combining district. And these are really going to focus on safety, environmental protection, and infrastructure improvements and the necessary emergency response capacity to address any environmental impact and any incidents. After the environmental impact report is completed, we would move into the project approval phase. Let me just say, after the environmental impact report is completed and the ordinance is adopted, we'd move into the project approval phase. This would involve any applicants submitting all the requirements that are in the ordinance, as well as all the other requirements that are already in the county's permitting structure, and the reports necessary to meet all of the state and national fire safety standards. And you can see that all the issues are addressed when we get to project approval, and this is where things get much more specific than what's in the ordinance. I think at this point, when we're ready to move through to project approval, there would be additional public hearings, and there would be very specific conditions of approval relative to the actual proposal. And then lastly, once all of the approvals have been obtained in operations, you would see continued efforts at safety, environmental protection, and emergency response. Because this is a long process, and I've heard some continued confusion, here again is the timeline and the next steps. If the board decides to move forward today, we would begin the environmental review process. Again, this is likely a supplemental document that's really focused to address the impacts of any particular energy storage facility that could be developed. The draft document would be prepared and circulated. There would be public comment periods and public meetings for that as well. After the environmental document is prepared, the ordinance would go through the adoption process, which would require feedback from the Agricultural Policy Advisory Commission and a recommendation from the Planning Commission. If the ordinance is adopted, only then would you actually end up considering any actual proposal. And that would be after the ordinance is adopted and requires its own set of public hearings and recommendations from the Planning Commission to the board, and the board would make the ultimate decision on whether to approve an actual project. And I would just like to add, because I didn't get to address it earlier, that this is one option in permitting for any particular applicant. There's also a state process under AB 205 called an opt-in process that's available to an applicant if we don't have our ordinance in place. And with that, this is a summary of recommended actions to consider the general plan and county code amendments. Again, we're not adopting them today. We'd just be moving them forward for environmental review. Direct the Community Development and Infrastructure Department to proceed with the environmental review. Prior recommendations from the Agricultural Policy Commission on any agricultural land impacts, and from the Planning Commission on the ordinance. We would return in August of this year with an update so that the board and the public are aware of where we are in the process. And then we would intend to return by November 2026 with the recommended amendments. I'm happy to answer some questions, and we also have other people in the audience who are knowledgeable and can help answer any questions the board has. Thank you.
Thank you, Ms. Hanson. I will now return to the board to see if there are any board questions. Supervisor Koenig.
Thank you, Chair. I'm wondering if either planning staff or perhaps it's a question for County Council could just discuss the consistency with Measure J. I mean, there's some description in our packet, but you know, if it got to the point where someone brought a lawsuit against the county for this ordinance being consistent with Measure J, can you describe how we would defend that and how we would justify these actions?
Yeah, I think this is a tag team, you know, answer, but from a legal perspective, I don't have any concerns at all that what your board is doing here would violate Measure J. So it's a little bit like searching for a needle in a haystack. People say Measure J, but they don't actually provide an analysis of why they think that it violates Measure J. So I have not seen anything indicating that Measure J is a problem around this. And maybe Ms. Hanson can supplement.
We don't either, Supervisor. We've included provisions to more than accommodate for any commercial ag impacts, and to protect more land than would be protected typically. So we think we're meeting the intent of Measure J.
Gotcha. Thanks to the offset language.
Yes.
I guess I have more comments, but I'll wait until after the public speak.
Thank you. Other questions from the board? Supervisor Hernandez?
Can you go back to the timeline chart that you had for the ordinance?
Sure.
I was checking to see so I wanted to make sure that people knew that part of this timeline is also opportunity for public input. Of course, today and environmental review is also part of that. I'm not sure if it's CEQA or NEPA or both. The commission hearings, the ag commissioner, and was it planning? Okay.
Yes.
So I just want to make sure that we also get noticed when those items are going to come up so we can announce them through our social media sites and through our outlets that we have, our newsletters that we have, so we can share that information with the community as well.
Yes, definitely.
Okay.
Any further questions? Supervisor Koenig?
Sure. I just a few other occurred to me that may come up during public comment. So maybe it's an opportunity for staff to address, which is related to the environmental impact report. I mean, I understand that we're planning on tiering off the sustainability updates, environmental impact report in order to for this project. And I'm wondering if maybe staff could just explain the rationale behind it, if we're not losing anything by not doing a full environmental impact report for this. I also understand that both the project and the ordinance are going to, the project proposal for Minto Road and the ordinance are expected to be considered under the same environmental impact report. Maybe you could discuss that a little bit. And then finally, who actually selects the environmental impact report consultant? Is that the county or the applicant?
Sure. Thank you. First of all, any type of environmental document that we prepare would be fully robust in terms of analyzing the impacts of conversion of ag land or any potential health impacts related to thermal runaway or other incidents. And as I mentioned, it would analyze, our emergency response systems as well to make sure there is adequate protection. Ultimately, there may be mitigation that comes up through the environmental review that encourages change to the ordinance, and that would be incorporated before we came back as well. We would fully intend that analysis be very robust, even if it's a little bit more targeted toward the impacts of a potential incident related to a facility and to the conversion that is allowed in the ordinance. We wouldn't be skipping any steps in terms of the environmental review. All of the components that need to be analyzed would be analyzed. A little bit more efficient, but that's it. In terms of the process, the board's original direction was to proceed both with the ordinance and review of the proposal. And the way you do that under CEQA is you're really analyzing the potential impacts associated with the ordinance, and any proposed facility becomes a reasonably foreseeable project under CEQA. And in that method, you capture both the greater impacts that might be related to the ordinance and any specific proposal that's out there in the world. That is fully how CEQA is supposed to work. The way the process works is that the county staff would release an RFP for to get consultant help to prepare the EIR. There's a certain kind of wall that kind of comes down between any applicant and the county because the CEQA document is our document. It's analyzing our actions, including adoption of the ordinance, the changes to the general plan that are needed as well, and are issuing approvals of any particular project. Therefore, under CEQA, we're the lead agency. We make the decisions and we hire the consultant. Did I miss something?
Well, then
there were a few parts.
And then, so there's a wall, but do we at some point send the applicant the bill?
In this case, because we're analyzing the actual proposal, the bill would fall to the applicant.
But as you said, we choose the consultant that actually performs the work.
Yes, and this is not atypical. This is how we've done it. For instance, the same process was used for the potential Kaiser facility on Soquel Ave.
Thanks. And then can you just elaborate just a tiny bit more, as far as tiering the EIR as opposed to starting a new one? I mean, what is it that what is the work that we're not duplicating with this strategy?
Well, in this case, the applicant is committed to preparing an initial study, and that really helps us understand where all the potential CEQA impacts or potential significant impacts might be. In that way, we can kind of focus the documents a little bit more on what are actual impacts instead of addressing every single CEQA resource. So for instance, the land use CEQA resource questions are really very specific and kind of odd, and they're all about dividing neighborhoods. I think that goes back to when Caltrans used to, build highways right through neighborhoods. Not so relevant here. So the initial study helps you kind of push those aside and really focus on the areas that you need to focus on. It's a much better option for everybody because it'll be a more efficient, shorter document.
Okay, thank you very much.
Any further questions? Seeing none, I would now like to take public comment on this item. If you intend to speak on this item, I ask that you please line up if you're able so we can get a sense of how many people are hoping to speak. And if you're participating via Zoom, please use the button to raise your hand or dial *9 if you're on the phone. Madam Clerk, how many speakers are you seeing?
I'm currently seeing 3 speakers online. The 4th just raised their hand.
Thank you. And it looks like we have less than 10 people who are currently lined up to speak. So given that, I'd like to set comment time at 2 minutes each. And with that, I'd like to invite the first public speaker to go ahead. Thank you.
Okay. Is the microphone? Okay, thank you. So actually, I do believe that the proposed ordinance as it stands right now does violate Measure J. So I strongly disagree with that statement earlier. And I'm going to read for you directly from Measure J, and I have a copy that I'm going to provide to the board. So the purpose, one purpose of this chapter, Measure J, is to state clearly various policies which should govern the future growth and development of Santa Cruz County. It is the purpose of this chapter to protect public health, safety, and welfare by regulating the future use and development of land in Santa Cruz County. Rapid population growth and development is causing extremely serious adverse environmental and economic effects, some of which are specified below. And they noted that loss of agricultural lands, adverse impacts to mineral and timber resources, fish and wildlife resources, marine habitats, air, water, and quality. In addition, scenic and aesthetic resources and water supplies. And so if you go to the agricultural lands under 17.01030, it is hereby determined that in order to minimize or eliminate such problems that I just noted, and to assure the public health and safety and welfare, the following policies shall guide the future growth and development of Santa Cruz County. Preserve agricultural lands. It shall be the policy of Santa Cruz County that prime agricultural lands and lands which are economically productive when used for agriculture shall be preserved for agricultural use. Not only that, but we also have to protect our resources. It shall be the policy of Santa Cruz County to prevent the division of other development of lands which contain timber, mineral, wildlife, habitat, and other resources. The proposed sites would affect all of that. To me, it's quite a stretch to say that this proposed ordinance does not affect Measure J. I would strongly recommend that you guys do your due diligence on this, and I'm going to give you a copy so you can start today. Thank you.
Thank you.
Hello, I'm Gregory Audino. I live near, anyhow, we live in Amesti. In 3 days, it'll be the anniversary of the Vistra Best Fire, when this all began. Well, actually, it began years earlier with the best industry frontmen expressing their interest in Santa Cruz County to previous and present county supervisors. What a great idea this would be. We can solve energy problems and provide tax revenue for the county. How much tax? How about the tax that will be lost from the loss of the land and the workers' lost wages? Wait, back up. Whose energy problems? It seems that on any given sunny day in Santa Cruz, that Santa Cruz County is a net exporter of electricity. Are they planning on storing this energy to sell it back to us or just to the highest bidder? We understand that half of the energy at the Parkfield facility down in Monterey, South Monterey County, is sold to Amazon or Google or Microsoft. If this is the case, then they need our energy to sell it to who pays more for it. Our county not only has an energy problem, our county only has an energy problem when a storm knocks out a power line. This BESS will be supplying the data centers and population of elsewhere, not here. Any revenue from the BESS facility will come from tax. Once it is built, it employs no one locally. It removes revenue from the use of the land and from agricultural business and local employment. It keeps our prime land out of use permanently. There is no going back. Are we going to continue to lose prime agricultural land? this 16 acres is prime ag land. This land is south-facing, south-sloping, again, prime agricultural land. The big picture for the future is not pretty, clean, safe, environmentally correct,
Thank
or
you.
even saving the world due to the pollution produced by mining, manufacturing,
Thank you.
distribution.
Hi, Corel Reader again from Corralitas. Came all the way up here today. You've heard me speak about some of my major concerns about the ordinance previously, and I want to thank the board, each one and every one of you, for allowing this time to go back and review and add some provisions that I think are very helpful. And I want to thank Stephanie for her hard work, because I know she got put kind of under the gun to get this done and to this point today. I'm not going to talk to you specifically about what I think still needs to be added. I've made those clear in my comments online. But what I want to talk to you about today is something that I know all of you board members and most of us probably go home and think about, but specifically to you board members, fiduciary duty. As we move this process forward, and I'm sure it will move forward, you are obligated to do everything in your power to protect your communities that you represent. You are, I know you sort of probably think about it every day, but in regard to this issue, it's particularly important. You need to feel when you vote that the ordinance that you are shaping, the future that you're shaping, is something where you would want to buy a house next to a energy storage facility, or you would want your children or grandchildren to be raised there. You need to think in terms of what you would do for yourself and then exceed that for what you're supposed to do for your community you represent. So I just ask you, as you vote today and as you vote in the future, please, please think about that, because there are dozens of families that are going to be impacted, and they might have to go to bed at night and not know if they're going to have to deal with an emergency.
Thank you.
Hello, Chair Martinez and members of the board. My name is Sophia Schwartzky, and I'm here on behalf of Central Coast Community Energy, the public agency that procures energy for 1.2 million Central Coast residents, including roughly 250,000 people in the county of Santa Cruz. 3CE is dedicated to delivering 100% clean and renewable energy. And part of that responsibility is ensuring we have reliable, affordable power for the communities we serve. Energy storage is essential to that mission. It allows us to store clean, low-cost energy when it is abundant and deliver it back to the grid when demand peaks, when prices rise, when the grid would otherwise rely heavily on fossil fuels. This helps keep energy affordable for families and businesses, while also increasing local reliability. Today's technology is more stable and more advanced than in years past. Senator Laird's Clean Energy Safety Act was recently signed by our governor and further strengthens safety by requiring new storage facilities to meet national fire protection standards and undergo coordination and inspection by local fire authorities. 3CE supports the proposed ordinance as it is reasonable, innovative, and maintains local control for the County of Santa Cruz. Establishing clear local guidelines will ensure that future storage projects are implemented in a way that protects public health, enhances resilience, and advances climate and energy goals. Thank you for your time this morning.
Thank you.
Good morning, board. My name is Christian Sweeney. I would like to reiterate my stance against any lithium battery storage systems going up due to their dangerous flammability and toxicity. I believe that you guys are in the roles that you are today because God has actually set you here for such a time as this to influence decisions and set standards today regarding this so-called green energy here with us. God has placed you here as leaders to make choices that are based, I believe, are supposed to be based in truth and love and real wisdom, and not what's popular and what's being pushed in society. And to be a part of healthy long-term solutions instead of partnering with new ways of poisoning our world and our community. Love does not delight in evil, but rejoices with the truth. It always protects. And protecting includes preserving our agricultural land, our water, and people's health. Protecting means saying no, sometimes hard no's, to toxicity, to financial gain, to external pressures, or pressures among yourselves. So in light of love, I would like to join in requesting that these battery energy projects are not allowed on agricultural land at all. Like it does, as Carol read, contradict Measure J. It's illegal. And I think there should be some genuine fear about what could come down the road legally. It compromises all of our ag land. Even if it wasn't on agricultural land, it's still compromising all of that, because what happens when a fire happens, it's compromising everything. And also still requesting to have at least 1,000-foot setback from these residential properties. And just encouraging town hall or meetings in Watsonville before this proceeds. Thank you.
Hi, my name is Diane Dutton-Jones, and ultimately, non-flammable BESS technologies represent a better standard in energy storage safety, enabling reliability, resilience, and sustainable power systems in urban and around agricultural environments without compromising public safety. Today, I recommend the draft BESS ordinance incorporate language that states, if the proposed technology is determined by the county to present no risk of thermal runaway, applications and are exempt from the requirements required for lithium-ion technology, like setbacks, fire, and plume modeling. Again, applicants would be strongly encouraged to select technologies with no or low thermal runaway risk. All BESS applications would have to include third-party written documentation evaluating whether the proposed battery technology poses a risk of thermal runaway. The absence of fire risk removes the need for excessive fire suppression systems and cooling infrastructure, which are required for lithium-ion BESS installations under international standards, and large fire separation distances, resulting in a significantly smaller installation footprint. This compact design enables more efficient use of land, which is especially valuable in urban settings where real estate is expensive and space is constrained. From a regulatory and economic standpoint, the reduced fire risk lowers insurance premiums and reduces installation and operational costs by eliminating the need for costly safety systems and extensive permitting processes. Furthermore, non-flammable, non-lithium chemistries that use non-toxic water-based electrolytes avoid hazardous materials like lithium, cobalt, and fluorine, maximizing environmental and human rights risks during manufacturing through end-of-life disposal. Please ensure the ordinance adopts regulations that incentivize applicants to use battery technology that is non-flammable and therefore cannot go into thermal runaway, and secures the safety of people and the environment. Thank you.
Thank you.
Thank you, Becky Steinbrunner. I take great umbrage with the claim that this is only about the ordinance, because we all know that New Leaf is guiding this. New Leaf has driven the county by the nose on this whole process. In fact, in the staff report, it says, if the board decides to move forward, a consultant team will be hired to prepare the supplemental environmental impact report to address both the ordinance and the proposed project at 90 Minto Road. So this is about the project, make no mistake. The developer has already created the initial study without any public meetings, without any public input. DUDEC has done it. We have learned from Ms. Hansen that that has been done, and DUDEC cannot review it. So who's going to be hired by the developer to do our ordinance supplemental review? I ask you to continue this discussion today. Do not make any decisions at all. You have completely left out the people of Watsonville. Holding this discussion here in Scotts Valley is disgusting. It should be continued to our February 10th meeting that is scheduled in Watsonville. Continue it today. Do not vote. And do not let New Leaf pressure you into doing that. I say let them go to the state because the state will make them do a full EIR. The state, as they did with Willow Rock Best, will hold them accountable to disadvantaged communities within 6 miles. They will hold them accountable to impacts for disadvantaged communities setbacks 1,000 meters, not 300 feet, 1,000 meters. That's over half a mile. So you need a technical panel to help advise you on this. I suggest hazardous materials, not OR3.
Thank you.
Thank you.
Hello, I'm Kathleen Lynch from Aptos. Piggybacking on what Becky just said, it's obvious this ordinance is also about the Minto Road project. And therefore, I would like to again respectfully ask Supervisor Martinez to recuse herself from any vote on the ordinance or the Minto Road project because she is on the board of directors of 3CE Energy, which stands to benefit financially from both the ordinance, which is written to facilitate the Minto Road project, and the Minto Road project, as 3CE is on record that they're planning to buy energy from the Minto Road project. So once again, as I asked at the November meeting, I'd like to ask Supervisor Martinez to recuse herself from any votes on this. And further, there's so many issues with the revised ordinance. It has inadequate requirement for the plume analysis of the toxic plume. It was the toxic plume analysis that was done only factored in one battery burning, not if a lot of batteries burned. And so the Minto Road analysis states no smoke or gas would extend beyond the footprint of the project. That is ridiculous. We saw what happened in Moss Landing. The plume got as far as my house in Seacliff Beach, where I was poisoned. So that puts all area residents and first responders at great risk because of inadequate planning and air monitoring that would be required otherwise. And then anyway, do not allow ag land to be taken out of production to satisfy economic wishes of New Leaf Energy. Thank you.
Honorable Chair, members of the board, good morning. My name is Max Christian. I'm the Senior Project Developer for New Leaf Energy, responsible for our proposed Seahawk Energy Storage Project near Watsonville. First, we'd like to acknowledge the substantial work by county staff to prepare the revised draft ordinance to incorporate the board's additional direction provided at its November 18th meeting. New Leaf has been committed to the local permitting process since our first engagement with county planning back in 2021. We've remained very active in community engagement with over 24 presentations to local groups, as well as a neighborhood meeting and community town hall in Watsonville. We'd also remind the board of the previously expressed local support for the ordinance, including former supervisor from McPherson, PV Fire Protection District, organized labor, environmental leaders, and substantially the recommendation to the board from the County Commission on the Environment to approve the ordinance. As proposed, and with the most recent revisions, the draft ordinance exceeds industry standards and imposes stringent protections for both public safety and the environment. The new outdoor containerized design is fundamentally different from the first generation battery storage projects constructed prior to the current national and California fire codes. The proposed ordinance ensures the protection of the public, first responders, and air, water, and soil quality, while providing direct benefits to county residents and supporting local, regional, and state climate goals. We urge the board to adopt the staff recommendation and progress the draft ordinance and project to environmental review. The need to transition to renewable energy is urgent. Any further delay or non-viable changes will force the project to pursue state permits in lieu of local approvals. We stand ready and willing to comply with the proposed ordinance, but the board must act to preserve local authority and meet the mandated public need for energy storage to support pressing climate goals. Thank you.
Thank you.
Hello, my name is Shirley Flores Munoz, and I am an interested citizen, born and raised in Watsonville. And I'm here to say at this point, I don't know why we have elected officials, because I feel like you are not listening to us. Nina Audio and Diane Dutton have organized 7 meetings where community people have come forward. Over 700 people have attended these meetings in interest and said they do not want this built on Minto Road. Minto Road is very different from Moss Landing, but we have the evidence of Moss Landing, and worse, we're going to have human damage if something happens there. Moss Landing just killed a bunch of strawberries. No, we're going to have residents living right next door. The other thing is I'm really disgusted because we're being industry driven. We are not being driven by chemical, scientific evidence about what could happen. We are driven by interest of the lithium battery people. Let me tell you, lithium is going to run out eventually. And then we're going to go on to something else, which is hopefully safer. China's using more safe medium at this point, and that's wonderful. But I have to say that before we jump into buying this lithium site, which is eventually going to run out, and also is dangerous to people, let's stop and think about this. What else can we do? At this point, I'm looking 7 generations ahead. I'm Native American of my background, and I'm telling you that we've got to plan something safer for people in transportation. And for me, the safest thing is teaching young people from 4th grade on to high school to use public transit. The way it's been used in Europe, the way it's being used in Australia, the way it's been used all over the world. Come on, America, let's get it together. We are not going to outlive this environmental crisis that we're in, and we've got to go forward, but with thought and caring and sustainability in our community. So I'm just willing to support any candidate who is speaking out against this battery side at this.
Good morning. Thank you for taking action and directing planning staff to strengthen the draft BESS ordinance. I really want to urge you to revise the draft ordinance further, like Skylar said earlier this morning. The current updated draft is still missing many specific regulations and doesn't contain strong enough compliance measures to protect people and the environment. The draft is still missing over 30 specific necessary regulations and standards, which I sent you. A few of the more egregious omissions are: there's no mention of large-scale fire testing. What happened? It was in the first draft. No plume study of a worst-case scenario where all 250-plus containers burn simultaneously. Acts of God do happen. We know they do. We know what happened in the Palisades fire. No requirement for the safest acute exposure level guideline of 1. No incentives for non-flammable, non-lithium battery technology, as Diane spoke to. No required impartial earthquake hazard and liquefaction analysis. No requirement for a full EIR for any proposed project, which would be required by the CEC. I really would like Stephanie Hansen to explain further about the initial study that the developer has created. In a full EIR process, CEQA mandates that the public has input on the initial study. There's a scoping period. It isn't the developer who scopes what is going to be analyzed in CEQA. It's people's comments and other agencies' comments. What happened to that? We need to have access to that 30-day initial scoping period. There's also violation of voter-approved Measure J's mandate to preserve agricultural land. And I think most egregiously, exclusion of dense residential neighborhoods where there are children, medically vulnerable people, the elderly, from the 1,000-foot protective setback. I urge you to please postpone your vote until that meeting in the Watsonville facility.
Thank you.
To provide equitable access to vulnerable populations immediately affected.
We will now move on to call-in speakers.
Leslie, your microphone's now available.
Yes, good morning. Thank you. I'm an Enromus resident about 15 miles from Moss Landing, and I co-direct the CCA Workforce and Environmental Justice Alliance. We work where environmental protection, climate action, equity, and workforce safety overlap. I want to speak to a concern raised this morning that an energy storage ordinance could add protections on paper, but still leave low-income or environmentally burdened communities exposed. That concern is exactly why the right step today is not to approve anything, but to move this draft ordinance into CEQA with clear direction around equity, siting, and real-world impacts. Nothing is being adopted today. This is not about taking the draft rules to the next stage where they can actually be tested and strengthened. And let me clarify, this is about taking the draft rules to the next stage. I know some people feel CEQA doesn't always deliver in practice. I think that concern is real, but CEQA is still the only process that requires the county to put cumulative impacts, siting patterns, safety risks, and enforceable mitigations on the public record before any rules are finalized. Environmental justice communities understand this better than most. Protections on paper aren't enough. What matters is whether they work in real life and can be enforced. So there are two questions that matter here. First, are risks being concentrated near affordable housing, schools, or communities that already carry more burden? CEQA is where the county is required to look at those patterns and correct them before locking anything in. And second, are those the same communities actually gaining resilience and affordability? Storage, when done right, can reduce resilience on expensive peak time natural gas generation, help stabilize energy costs, and improve reliability, especially for households already stretched thin. Thank you.
Thank you.
Watsonville Yoga, your microphone's now available.
Hello, my name is Phoenix Artemisia. I oppose the proposed Seahawk lithium battery storage project at Minto Road. The proposed facility is next to Pinto Lake and in the middle of a largely populated rural neighborhood community with many children and elders. The project aims to make use of a private landowner's desire to benefit financially from the sale of his land, which is near the Lapis Minto PG&E substation, but there are hundreds of homes right in the area of the proposed site and thousands of people. Pinto Lake is a 10,000-year-old natural lake which has suffered so much abuse in the last 50 years because of toxic agricultural practices and resulting algae blooms. You can't even touch the water. Local residents cannot swim or fish in the lake. It's insulting to the natural resource of Pinto Lake and to our rural community that practically overnight and with very little opportunity for public input, a private landowner sold to Seahawk and a deal was made which will pose harm and a clear threat to the larger Watsonville area and miles into Santa Cruz, storing these flammable batteries here at Minto Road. Seahawk has said, oh no, their batteries are self-extinguishing, but none of the residents have seen evidence of that. Where is information about these supposedly better than Moss Landing kind of batteries? New Leaf Seahawk appears to think it has its deal in the bag. There's been a devastating lack of respect towards the residents in providing real evidence that their battery storage project is safe for us. Nothing has been mailed to us, for example. I live 1.3 miles away and have never gotten anything from New Leaf. An environmental impact report separate from the ordinance must be made. Meetings with the board involving community members must be focused in Watsonville regarding impacts here. I was only made aware of this one meeting through a Facebook post where the people were crowing about how green this decision would be. The owner of the property that got sold for the site was strutting like a rooster for the money he made at all of our expense. The Moss Landing fire contaminated the slough and has caused health problems for countless people, likely well into their living futures. On that, to the representative for New Leaf who spoke, your proposed storage unit is not, quote, near Watsonville. You obviously do not know our area.
Thank you.
Your site is smack dab in rural Watsonville.
I'd like to ask the audience to refrain from clapping for other speakers in order to ensure that we have a very welcoming and inclusive space. We want all speakers to feel welcome to share their comments, and sometimes the applause inhibits that. So please move on to the next speaker. Thank you.
Beverly, your microphone is now available.
Good afternoon, almost. This is Beverly Deschaux. I'm with the Electric Vehicle Association, and I've been learning about and talking about battery storage for many years, 19 to be exact. If people would just understand, the Commission on the Environment did a presentation that talked about all of this, and after it, asking people if they learned anything, they still said no lithium batteries. The chemistry that's being used now, not only the chemistry, but the architecture of what's being used now will never repeat what happened in Moss Landing. Of course, the community is upset, and justifiably so. But if they would learn about things instead of sticking to their beliefs and assuming that the company who wants to install them is doing it just for money and just to make profits, it would expedite the whole process more quickly. It's astonishing to me that ag land is being used as the problem. There is ongoingly, every day, sprays, toxic sprays that are ruining the soil, the air, the water, the workers, the people who eat it. And yet to say that these batteries shouldn't be there because of that, Megapacks have at least 8 systems that are being monitored 24/7 to make sure that nothing occurs. Some minor incidences that have occurred have been extinguished immediately within the pack. They're outside now. They don't ignite other battery packs. Please, we need this. We are in an emergency.
Thank you.
Doss, your microphone is now available.
Thank you so much. My name is Doss Williams. I represent Central Coast Community Energy. And I want to say, first of all, that 3CE does not have a power purchase agreement or other financial relationship with this battery project. And I think that I would at least like to know what the previous public speaker was basing their facts on by asking Supervisor Martinez to recuse herself. We have no financial interest in this project beyond our principles. And our principles are that we believe in renewable power. That's why 3CE was founded. We believe that that should be local, and we believe that local control should be preserved. What is necessary for all of these 3 things is for the ordinance to move forward, environmental review to be done, and you to be able to evaluate the project on its actual merits. I think personally what is at stake is the question of whether renewable power will be provided in coastal counties where the demand is. Santa Cruz County is not a net exporter of energy. Most energy in the state is produced inland. And for us to achieve 100% renewable power, that is not possible if all of the energy is remote. Some of it has to be in our own communities, and our communities will benefit from it. Thank you.
Thank you.
Call-in user 3, your microphone is now available.
Marilyn Garrett, and you state you want to hear everybody. Please do not cut people off in mid-sentence. I urge you to continue this item to the February 10th Watsonville City Council meeting. Measure J, a referendum passed by the voters, is to protect, not pollute, agricultural land. This proposed ordinance provides permits to poison, and I felt like I was listening to the staff report on how to arrange the chairs on the Titanic. We call for a ban on all BESS sites in Santa Cruz County. When John Leopold was supervisor, he wisely authored a ban on ecologically devastating fracking. To not prohibit lithium battery fires, so-called storage facilities, is to mandate these known consequences, as the January Moss Landing fire demonstrated. With no informed consent, you will be mandating more toxic chemical nanoparticle contamination and nanoparticle metal contamination of our air, water, and soil, forever polluted farmland. This is true. Violations of our right to health. You will be prioritizing New Leaf Energy profits to the detriment of public health, violating your oath of office to assure our well-being. Do not,
Thank you.
call for you to
Nyonko, your microphone is now available.
Yes, hello. The LA County Firefighters Union has issued a cease and desist, a rare and serious warning, calling for an immediate halt to large-scale lithium battery storage projects near homes and fire stations. This isn't political theater. It's frontline professionals saying we are not prepared to safely respond to these fires and the public is at risk. At the same time, safer alternatives are no longer hypothetical. Amperex, a global battery leader, has confirmed that its sodium-ion technology has passed required safety tests and is moving towards large-scale deployment for vehicles and energy storage this year. So the question before us is simple. Why rush dangerous infrastructure into our neighborhoods when safer technology is already fast becoming available? Public safety demands caution, not shortcuts. When firefighters say stop, we should listen and choose solutions that protect lives, not gamble with them. Thank you.
Thank you.
I see no further speakers online, Chair.
Thank you, Madam Clerk. I'll now return to the board for a motion or discussion. Start with Supervisor Cummings.
Thank you, Chair. I just want to thank all the members of the public who've been so engaging in this topic over the past 2 years now, I believe. It's a pretty challenging decision for us to make, and it's a pretty challenging topic for us to work on, especially given the fact that this is another instance where a lot of local control has been removed by the state, where if we don't try to work together as a community to figure something out, the state's just going to approve it, and we don't know what that would look like. And so I think that, throughout this course of time, we've really been trying to balance the needs of having clean energy and supporting clean energy and reducing our carbon emissions, while also ensuring the safety that when these facilities are implemented, they're going to be done so in a way that's to the greatest safety standards possible. And I think we're trying to get there. One of the questions I actually have for County Council, I know the question about AGLA and KNUP, and I was just wondering if this were to go through the state process, would the state be allowed to or be able to allow for these facilities on agricultural land within the county? Maybe that's for County Council.
Yeah, that's an interesting question. I mean, it's a preemption question, essentially, that I would want to look a lot more into before giving you an answer. But my initial feeling is that the state law is going to supersede anything related to local, something like Measure J, for example. And this kind of ties back into the question that Supervisor Koenig asked, and some of the public comment focused on what the purpose of Measure J was and what the intent of Measure J was. And I still have yet to see any specific regulation in Measure J that would be violated by anything that your board is contemplating doing here. And so, you know, the question is a little bit abstract for me at this point because I would need to see exactly what the state is proposing versus exactly what is in Measure J. But I don't believe that the state fundamentally is going to be restricted by anything related to Measure J in approving an application for an S facility.
Okay, thank you. So with that, there were a couple minor changes that I think would be beneficial around the ag line. I did see under 1310-408B1, the lowercase b ag resources, that there was a 1-to-1 ratio for ag land conversions. And I think that at the last board meeting, we did say we wanted a 3-to-1. And so I'd like to make sure that that change is incorporated. Additionally, when we're referencing agricultural conservation easements, I think it's really important that includes the requirement that these easements shall be on viable and accessible agricultural land. There are substandard agricultural lands, and if we're taking commercial ag out of operations, we need to ensure that we're protecting other commercial agricultural land that's of high value. And then lastly, in terms of ownership change, so under 1310-409I, right now it allows for the ownership transfer to be between two parties, and I think that the ownership change should have to be approved by the county. So under ownership change, I'd like to see a change to any change in ownership of a ESS facility shall be approved in advance by the county. Project approvals shall remain in effect, and the successor owner or operator shall assume in writing all the obligations of the project site plan approval and decommissioning. So this is aligned with what staff is recommending, but actually strengthens it further because rather than having to notify the county of the transfer of the facility, the county would actually have to approve it. And I think that that'll provide an extra layer of oversight, especially because if there's a bad actor that's trying to purchase one of these facilities, we'll be able to do our due diligence before that transfer is made. And so I'm happy to make a motion with those additional amendments.
Supervisor Cummings, I just had a question about your comment about the 3-to-1 ratio.
Sure.
Staff did try to address that in a way that threaded the needle a little bit more and tried to get to a 1-to-1 on direct commercial ag resources. And if that was not possible for some reason, to go to a 3-to-1 ratio that would include other resources for sensitive habitat and the like. And I want to make sure that that you saw that in the ordinance, and want to make sure that Ms. Hansen has an opportunity to also kind of answer any questions that you would have around that, because I think the concern that staff had when we were working through it is that there wasn't an analysis at the time regarding why a 3-to-1 as opposed to a 4-to-1 or a 5-to-1 or a 2-to-1, you know, and we were concerned about the idea that without that analysis, that the feasibility of any project anywhere would be compromised in some respect. And so I don't know if Ms. Hansen has something else that she wants to provide in that, or whether you have other ideas, for example, about how to address the specific concern that you had other than a 3-to-1 ratio.
I guess I have nothing to add to, and I agree with Jason's concerns. We do look at the feasibility of finding commercial ag land, meeting those criteria to be pretty difficult and onerous. So we were looking at other options that might be available to a developer, including the potential for other lands to be conserved, such as habitat. So we're certainly open to other ideas if they're out there.
So I guess I'll just say one of the things that's come across that's been pretty clear from the community is the concerns around ag land. I'll just say as a biologist, knowing that ag land is very scarce, and the more that we develop on commercial ag land, the less there is. It's going to be really problematic in terms of meeting our food demands. And so I guess what I would recommend then is that since this has come back so quickly, that maybe didn't give staff enough time to bring back or conduct an analysis. So I think that then what I would ask is rather than that change be made that, or before we consider a 1-to-1 ratio, that we've continued to analyze the potential for a 3-to-1 replacement of commercial ag land. As we've just discussed today, this is a very long process. This is going to go to many other committees. It's going to go to the Ag Committee. It's going to go to Planning Commission. So there's time for us to continue to do these analyses. So I would like that to be incorporated. And then when this comes back to the board, maybe there'll be more information about how the feasibility of that 3-to-1 placement.
No, that's very helpful for our process, our part of this. And that's what I really wanted to confirm is whether you were inviting the board to make a hard decision right now as to those numbers, or whether the board was still open to an analysis or discussion around that.
Yeah, I think we have time, but I just want us to continue to move in that direction as of right now. And if we can't get there, then we can consider alternative. I think that if there's going to be a 3-to-1 replacement of these other types of lands, we also need to understand why that's the case too, if we're not going to move forward with the 3-to-1 replacement that we agreed on the last meeting. So with that, I'll move the staff recommendations with the additional direction that was provided by Supervisor Cummings. And I'm happy to put this in an email and send you the appropriate language. But if I need to read it again, I can read it again as well.
We have a motion. Is there a second?
Second.
We have a motion from Supervisor Cummings and a second from Supervisor Koenig. Further discussion. Supervisor DeSerpa.
So I've been out to that property a couple of times, and from what I can see, it appears to be a very old apple orchard that is not productive. So it's not like it's productive agriculture land, I don't think, at this time. Having said that, I'm a huge proponent of agriculture, and I don't love the idea of converting any agricultural land. So anyway, so I don't know what the analysis will be on the 3-to-1. What my understanding is, and potentially staff could clarify, and thank you staff for continuing to work hard on this. I know that this was a very short timeline and that you all worked hard over the month of December to get this in front of us today. My understanding is that potentially, if we don't act on something like this today, that the company who's proposed this could bypass us completely and go directly to the state. Is that what we're facing?
Yes.
Yes. Okay. So I am prepared to support this today. This is an ordinance in concept, and thank you to all the speakers today for voicing your concerns. Many of us here share those concerns. I was out at the Elkhorn Slough Foundation at the reserve. I was on the slough. I was at the reserve last week and had a briefing. I think there's a meeting coming up at the Marine lab to talk about the environmental impacts from the Vistra fire. And I'm not sure if we missed that meeting or if it's upcoming this next weekend, but I'll put something up on my website and send an email out to everybody about that. Thank you.
Supervisor Hernandez.
Thank you, Chair. I did have the opportunity to talk to a few Solano County supervisors, and one of the things they mentioned to me is that they had an ordinance that went south on them. And I want to thank also partially thank Stephanie for all her work behind this ordinance and all the planning staff and CDI. So they told me that they're looking actually at our ordinance now in Santa Cruz County. So thank you for this ordinance that we have before us. But before taking any motion, I wanted to make a note that this item does follow an extensive public process, including community meetings, individual stakeholder discussions, hearings before on the commission, and environment, and additional opportunities for public input. And we still have additional opportunities for public input. I also want to emphasize that today's action is it's not an approval of a specific project. The issue before the board is whether to continue evaluating the potential general plan and county code amendments, the policy framework that would guide future energy storage facilities, should any be proposed. It could be that none be proposed. So I just wanted to make sure that we knew that. and also to notify us every step of the way when there's opportunities for public input.
Thank you, Supervisor Hernandez. Supervisor Koenig?
Thank you, Chair. I think actually, it's really all my colleagues have pointed out, I think if this was a decision resting entirely within our control, then the conversation would be different. But given that there is an alternative pathway, we really, that available to the applicant, I think we're getting, I think that we're putting some really good safeguards in place with this ordinance that I don't think we would necessarily get through the state process. Thank you, Ms. Hanson, for the presentation. It really helped to enumerate some of those, but it's worth repeating, right? All facilities shall test air, surface water, groundwater, and soil on a yearly basis, so that we do have some kind of an incident will not be in the same situation as what happened at Moss Landing, where we don't have data from before the incident to compare to. All facilities shall be supported by an engineered catchment system capable of collecting and retaining on-site all potential runoff of liquids and materials used to combat a fire. This helps to address the issue that this facility will be adjacent to College Lake, which is an important resource for migratory birds and will prevent the contamination of that. So it's great to see that included. Prior to commissioning, the responsible fire district shall inspect the energy storage system. Other responding agencies shall receive an initial emergency response training. Will be qualitative and quantitative risk analysis of thermal runaway, a thermal runaway plume modeling analysis. Documentation is required of a dedicated fire water supply. So we know that fire actually could be put out with adequate water. As an additional aspect of the financial assurances, the applicant shall acknowledge the responsibility and agreement to reimburse all damaged parties for an assessment of damage to the environment, agriculture, residents, and businesses conducted by one or more third-party consultants selected by the county. Annual contributions for fire response equipment as deemed necessary by the responsible fire district. The fire district, not the applicant. Annual contribution for training of emergency response agencies and mutual aid partners for emergency responses. And finally, ownership changes. If the owner of a facility changes or the owner of the property changes, project approval shall remain in effect, but providing the successor owner or operator assumes in writing all the obligations of the project site plan and decommissioning plan. This is pretty tight and it ensures both financial and environmental protections for our community. And again, I think if we had the opportunity to eliminate all risk by not approving a project at all or making one impossible, I would seriously consider that option. We don't. We have to simply minimize, and I think that this ordinance does that. So that's why I support moving this forward into the CEQA process today. Thank you.
Thank you, Supervisor Koenig. Just a question on the motion. The motion includes a requirement that the county approves a sale of the project to another owner. Is that my correct understanding? Can I just ask if county council can weigh in? Is that something that we're able to dictate, or is that something within our control?
Can you discuss that portion of the motion in a little more detail, Supervisor? So we can have a little more context.
Sure. The idea is that when there's a change in ownership, that approval comes through the county, rather than that being made between the two operators to ensure that the person who, if there's a new company coming in, that they're reliable and that they have a good record of standing, and that the county is able to make sure that they're consistent, because what the language says right now is that they have to send us a letter of the transfer, right? And I kind of think about this, for example, I remember back when I was in the city council with cannabis license transfers, it was up until very recently that if there was a transfer of the license, then the owner had to get out of the license, they had to come to the county to receive the license. So if a new operator came in, they had to buy the license directly from the city. And so I'm thinking about it within that context of, if we're going to have a new operator coming in, that they're going to need to come to the county to get approval for being able to operate that facility rather than the transfer of the ownership go directly to some other group that maybe doesn't have a good track record or good history. Because I think at the core of it all, everybody's been really concerned. I mean, Vistra has pretty, they don't have that good of a record. And we don't want to have a company like that come in because yes, New Leaf is gonna, develop this potential site or some other developer could come in. But if they sell it at some point, which happens, and it's sold to another party who maybe our community would not be okay with operating that kind of facility, we would want to have some level or opportunity for the county to kind of intervene.
Yeah, so I understand the intent, and what I'm taking from the language that you presented in the motion is for us to work with that intent and try to insert some language. I think this is an area where the board can regulate, but the specific language might differ a little bit from what you're proposing, and it'll. Again, long process. This is going to go through many revisions and iterations before anyone was to get to a final vote on it. So what I take from that is we'll go back and try to insert some language to address that issue.
Yep, that'd be helpful.
Thank you for the clarity, both of you. As far as my final comments, I want to thank the staff for coming back with further due diligence based on the comments that came from the board back in November. I think you did a good job. I think you did what we asked of you. So thank you for that. Ultimately, I believe that what the board is asking for in these core components of an ordinance is stronger and better than what we would get through a state process. And as a result, I feel like the board has done a good job in directing staff to move forward with the next steps. So I appreciate the staff for bringing it forward. And I'm going to be asking the clerk to call the roll call. But before we do that, can I ask the maker of the motion to state the motion one final time?
Okay, so move the staff recommendation with the additional direction. 1, references to agricultural conservation easements shall include the requirement that these easements shall be on viable and accessible agricultural land. 2, substitute the following language for section 13.10.409I, ownership change. Any change in ownership of an ESS facility shall be approved in advance by the county. Project approval shall remain in effect, and the successor owner or operator shall assume in writing all the obligations of the project, site plan approvals, and decommissioning. And then 3.13.10.408 B1B, agricultural resources. Staff continues to analyze the feasibility of a 3-to-1 commercial agricultural replacement and return with an explanation of the final recommendation.
Thank you. And for clarity, that matches the intent of the discussion that happened earlier. Correct. Okay, great. Madam Clerk, will you please call the roll?
Supervisor DeSerpa.
Aye.
Koenig.
Aye.
Hernandez.
Aye.
Cummings.
Aye.
And Martinez.
Aye. Motion passes 5-0. We are now going to move on to item number 9.1, which was item number 16, which was pulled from the consent agenda. Adopting a resolution directing staff to explore the viability of housing opportunities on a portion of the county government center and Water Street campuses and take related actions. Supervisor Cummings.
Thank you, Chair. Yeah, I just wanted to get some, let's wait till the room.
Sure.
All right, we'll take 2.
We're going to just take a 60-second pause as the room clears. Thank you. Thank you for your patience. We're just waiting Supervisor Cummings to come back as he pulled the item. Thank you. Supervisor Cummings.
Thank you, Chair. This item is related to housing proposals for county-owned properties. And I thought there was a study that had been done in the past on this. I'm wondering if maybe staff can speak to the history of this item, maybe any considerations in the past for construction on the site, because I thought I'd heard and learned that there was a previous study done, so just wanted to know if that's the case.
I'm going to ask Kimberly Finley, Director of General Services, and Peter Detlefs to talk about that.
Hi, good afternoon, Chair and members of the board. My name is Kimberly Finley. I'm the Director of General Services. Yes, thank you so much for bringing that up. So we had performed a long-range facilities plan in 2020 and 2021, which was approved by our board. As part of that long-range facility plan, there was a direction to pursue a master plan effort at Freedom Campus, 701, and Emmeline, I believe. We did pursue the master plan at Freedom, and we began initial discussions about 701 Ocean Street. However, with the COVID pandemic, our priorities changed, and we put that effort on hold, and it never proceeded.
And additionally, we did hire Grun and Associates, who did some of the initial economic analysis when we did the long-range facility plan to complete a study 2 years ago-ish to look at the financial viability at that time for all three sites, Freedom, Emmeline, and 701 as well.
And is there ability for us to get access to those studies? Because I just see us going into another round of studies and spending money on studies that sounded like maybe had been done in the past. And so I'm just trying to make sure that as we're, especially during a fiscally challenging time, if this has already been analyzed at one point, then, why are we spending money to go back and do it again? But
yes, we can make those studies available to you.
Yeah, thanks. And then the other question I had around this, which really has me concerned, is the discussion of using what is probably one of the county's larger pieces of property that's near transit stops and that we own. Why we're considering that for market rate housing. I think that we know that we have a huge housing demand for our workforce and we need affordable housing. We're in an affordability crisis, but one of the things that's called out in this study is conducting a market rate, is considering using those properties for market rate housing, which we have a ton of that going up, especially in my district. And we know that what's really hard for us to build is housing for our workforce and affordable housing. So I'm just really kind of perplexed as to why that's incorporated into this.
We are looking at affordable housing on the site in addition to workforce housing, but we are contemplating market rate housing and able to support the revenue for the workforce housing.
Okay.
If I may. Yeah, thank you. So Grun, if that, in case, the last study that was done on this basically came back and said that housing at 701 Ocean Street was not feasible, even if we gave the land away. And that was looking at I think more of a traditional sort of 5/1 or 5/2, right? Like wood construction over a couple of stories of cement, much of that parking, or maybe some commercial. Pretty much the best prospect in that report was 3-story wood frame construction at Emmeline, where you could have surface street or surface level parking. In any case, I think that this is not so much commissioning another study, so much as putting out, it's a request for interest, basically to say, okay, that report said it's not feasible. What this is doing is saying, okay, well, builders, developers, tell us how it would be feasible. Is there any, way you could put together these blocks, including, and all things are on the table. I mean, if it means a new county building, because that means that the residential could be closer to the water or to the river, which is more attractive. Like, we want to hear it. How could this work? And so, and to staff's point, like at this point, we don't want to say it has to be 100% workforce or 100% affordable, because some of that market rate housing may be necessary to offset the cost and ensure that we get some of it. So, I mean, at this point, it's just trying to understand what might be possible and how we could get, ultimately, yes, I agree. The goal is to maximize workforce units and affordable units. And so I think we just need to see different avenues to get there. Well, I'm supportive of the direction, and I'm really grateful that we're coming back to take this step, because that initial study was not as encouraging. So, if first you don't succeed, try again, and we have to see how could it work if sort of under these standard conditions it doesn't.
That's correct. Since the time we did that study, right, a significant amount of housing has been built in downtown Santa Cruz, which was not available at the time when we did that study.
Are there further questions from the board? I have a Supervisor DeSerpa.
So in terms of this feasibility study, I guess is how we call it, about how much is that going to cost the county? And just a ballpark, it doesn't have to be exact.
I suspect it would be probably in the $50,000 to $100,000 range, given the complexity of this. I mean, we have significant number of county uses on the site that we would need to find, relocation for. So it's more than just looking at the feasibility of the housing itself on a clear site.
So I know that, I think I know that like the courthouse is slated also for demolition and rebuild because it doesn't meet, I think, seismic standards by today's standard. So is there any thought into coordinating with the state around rebuild out of the whole campus?
Yeah, it's a very complicated site, particularly with the efforts with the court. So that'll all be part of that analysis.
Supervisor DeSerpa, that's a difference this time too, is that we want to look at the campus. I think the focus last time was more on the Ocean Street side, and we will have to coordinate with the Judicial Council of California, which actually owns the courthouse. They are on the list for state funding, and they're in the top tier for their replacement building due to their seismic concerns. And so this could it could be a win-win if we're able to get proposals back from developers that indicate that we can make best use of the entire site with potentially creating space for a new courthouse, maybe a new county building, new housing, and whatever that mix is, so we can best use the value of the land and the development to put into these new facilities. It could really help us move all projects along.
Thank you.
That ties to my follow-up question. I believe the city of Santa Cruz has an Ocean Street area plan that they've developed. Is this something that would be done in partnership with them as well?
Yes. Cool. We've had initial conversations with the city. We'll, based on this direction, pick up those negotiations with the city on.
Thank you. One more question from.
I will say that the optics of building out a new campus, like we all know we need more housing, like that's not the problem. But the problem is if then we're also going to build out a new headquarters, essentially, when we have other infrastructure in all of our districts that are crumbling. The optics of that is not. So I guess I'd like to know what the plan is in terms of how much it's going to cost, and then what our plan is to help and repair our infrastructure needs right now.
Yeah, absolutely. That's a great question. So as mentioned, this is just a viability study to understand what sort of development could pencil. If the recommendation is that the location that faces the water would be the most probable development and the best for all parties, then we would come back and present that information for your board. This is not a recommendation on the development to move forward or to build a new county building right now. It's just an information seeking effort to understand the constraints of the site and the viability of any sort of development.
Thank you. I'll now open it up to the public for comment. Do we have anybody in the audience who'd like to speak on this item? Seeing none, do we have anybody on the phone?
Yes, Chair. Call in user 3. Your microphone is now available.
Marilyn Garrett. I see this proposal as part of the laws of the commons or what belongs to the public on a larger perspective with public land going to certain corporate interests. And this seems to me public property going to speculators and developers. A friend called development. She said it's not development, it's desecration and despoilment. And this, I think, is not what public officials should be doing. Also, you talk about affordable. To whom? Who can afford these places? They aren't really affordable. With the increase in unemployment and the decline of population, who's going to move into there? Will a project be completed? I drive by the Park Avenue site near the freeway that was abandoned in the middle. It didn't get completed. There's like plastic over the development. So this does not sound like a good or appropriate or in the interest of the public project. I would recommend you abandon it. You have much else on your plate to take care of in the genuine public interest. Thank you.
Thank you.
I see no further speakers online, Chair.
Thank you. I'll now bring it back to the board for a motion. Supervisor Cummings.
Thank you, Chair. So I just would like to see if we can add one bit of language to this, which would be under the now therefore of the Board of Supervisors under number 1. It reads, County General Services Department staff shall explore the viability of utilizing a portion of the government center and or Water Street for workforce affordable and or market rate housing development and associated parking in a manner consistent with county operational and infrastructure needs. I'd just like to add with an emphasis on prioritizing workforce and affordable housing. I think it's really, yes, let's keep all of our options open. Let's explore market rate. But I really think that we should be emphasizing and sending that message to the community. We do want to prioritize housing for our workforce and for and the housing that's affordable for folks in our community, especially our county workers. And I will just say that the place I'm coming from with this, having worked on the library parking affordable housing project when I was on the city council, that was an extremely complicated project that we were able to figure out and get across the finish line in terms of being able to provide library, I think 127 units of affordable housing and parking. And if we're going to explore this, I think that it's really critical that we're really trying to see how we can make, a new government service center work with parking and affordable housing and the kind of office space and infrastructure that we need to run our county. And so that's my motion.
I'll second.
We have a motion from Supervisor Cummings and a second from Supervisor Hernandez. Any further comments from the board? Seeing none, Madam Clerk, please call the roll.
Supervisor DeSerpa.
Aye.
Koenig.
Aye.
Hernandez.
Aye.
Cummings.
Aye.
And Martinez.
Aye. Motion passes 5-0. And that concludes our agenda. Correct? Oh, we have closed session. Thank you. We'll now be moving on to closed session. Do we have anything reportable from closed session?
No, nothing reportable today.
Okay, with that, we will adjourn. Thank you.